Recording in progress.
Testing. Hi, Julie, are you ready?
Yes, I'm here.
Sounds good. Okay, perfect. I'm gonna have Donna come up to the screen and then do the intro, and then they're gonna pass over to you. Okay.
Okay, great.
Welcome to today's webinar hosted by eLotus and sponsored by Evergreen Herbs. We take pride in being your trusted source for quality CEU content. With over 2 decades of experience in providing educational courses, our goal is to help you enhance your knowledge and expand your skill set. Featuring over 250 speakers, 900 courses, and 3,500 hours of continuing education, we are committed to delivering the best educational experience possible. My name is Donna Chow, and I will be your host and your moderator for today's webinar, and I'm delighted to guide you through today's session. Today's class is titled Shingles Treatment with Acupuncture and Herbal Formulas, presented by Dr. Julie Armstrong. This webinar is part of our series of new herbal CEU webinars for the year. Chinese herbal medicine doesn't always receive much attention in TCM healthcare, so we hope that webinars like this will help experienced herbal professionals in refining their skills and beginners in embarking on their professional journeys. Today's class will run from 10 to 2 p.m. Pacific time with 1 break. And before we begin, let me highlight some important Zoom features. First, we have our chat room. It's an excellent tool for connecting with your colleagues and our speakers. So we do ask that you set your chat preference to everyone so that everyone can be part of the conversation. Secondly is our Q&A box, is where you can ask questions to the speaker. We do ask that you limit your questions to relevant topics to ensure an organized and efficient session. And lastly, for those who qualify, the CEU quiz will be available on the following workday, and I will send an email out when it's ready, so do look out for that. Our speaker today is Julie Armstrong, a licensed acupuncturist in Arizona and California. Dr. Armstrong specializes in TCM for chronic disorders, scalp and kinetic acupuncture for neural rehabilitation, gynecology, and pediatrics. She combines her deep knowledge of physiology and medicine, intuitive sense from her Reiki practice, and the determination of a mother challenging the big pharma mindset to provide natural care for her son and thousands of patients. This combination of medical knowledge, Reiki, and passion consistently leads to successful outcomes for patients and a thriving practice year after year. Let's dive into today's session and discover something new. Dr. Armstrong, we are excited to see what you have in store for us, so we do invite you now to go ahead and share your PowerPoint presentation. Let's get started, guys.
Thank you, Donna. Hello, everyone. I see a lot of folks tuning in from California. If you want to put in your chat box where you're coming from, I saw one from Wisconsin. I'm from California myself. Here, I'm going to share my screen here. See. All right, can everybody see my screen?
We do, but not the full screen for some reason.
Okay, let me try again.
All right.
All right, are you seeing my screen now?
Yep.
Great. All right, So welcome. Thank you. I'm excited for this presentation. So today we'll be talking about shingles or herpes zoster. I've had a number of patients who have come in with active shingles, also a number of patients who have come in with postherpetic neuralgia. And I've had a lot of great success in treating shingles. Postherpetic neuralgia is quite difficult to treat. I don't know if you all have treated that yourself. If you want to comment on that, I'd be happy to hear about that. Because PHN is so difficult to treat, that prompted me to want to talk about shingles and try to get more education out there for practitioners and for patients themselves that we can treat shingles very successfully, and the earlier the better. So today, if you see my outline here, I'll just give a brief introduction about myself and my why of why I'm doing this. And we'll talk about shingles, the background, what it is, how prevalent it is in the United States, its etiology and pathogenesis, the different stages of the disease, the different patterns that it can take on, some complications that we have seen with shingles, also what Western medicine is doing for shingles. And then we'll dive into the Chinese medical perspective. So looking at the etiology and pathogenesis from a TCM mindset, go over a differential diagnosis of what types of patterns to be looking for. And then we'll go into the treatment principles and strategies that I use in my clinic in Tucson, Arizona. Also then how to educate your patients of when to come in and when to seek treatment and what to look for. And then we'll have some time for questions. And I have provided my reference list in case anybody's interested in diving deeper into this topic. So if we move forward, just to give you a little introduction to me, I almost 27 years ago, I had my first child. His name's Joe. He's there on the left of your screen. We had a very severe birth complication. I was full term, but he was losing oxygen. We had an abruption of the placenta, and he lost oxygen for 2 hours while inside of me, which is pretty amazing that he's even alive, to be honest. And so this led me into my journey. They weren't sure how Joe would be, if he would live, if he would die, how disabled he would be. He ended up being quite disabled. And he had a very severe form of seizure disorder, in which, as a newborn, they prescribed him phenobarbital. And if any of you are aware about what phenobarbital is like, it is a barbiturate, a hallucinogenic drug, very toxic to the liver and kidneys. And I was really not happy with giving him that medication. I thought it was really quite strange to give my newborn child a hallucinogenic drug. And so that is when I found Chinese medicine. I researched and I found a doctor in my area in Los Angeles who was able to prescribe me Chinese herbs in order to eliminate his seizure activity, as opposed to just controlling it with this harmful drug. So I went ahead and weaned him off of the phenobarbital, and I gave him these Chinese herbs, to the dismay of my current pediatrician that I was seeing. The pediatrician told me that if I did this, I was the worst mother he ever met in his life, which I was taken aback by, because I was just trying to do something different that was, less harmful to my child. And I found a new doctor who was supportive of me doing this. So he went from having severe epileptic form seizures while medicated, while asleep, not being stimulated, to 3 months later, not being on medication. He had finished his herbal regimen. He was awake, being stimulated, zero seizure activity. So this started me on my journey with him. And I continued to use Chinese medicine for him for a number of issues, which helped him tremendously. And I've had to fight along the way quite a bit to the traditional Western doctors. I've had child protective services called on me. I've had adult protective services called on me for not doing what they deemed necessary for him. For example, antibiotics. I was able to give him herbs for treating some minor infections, which worked well. But I've had to fight. I've put up a fight. Like I said, he's almost 27 now. So it's been a long journey. And then to talk about my why for this topic. So one of the reasons I chose shingles is my own experience, but also you see that's my daughter on the right. She's my fifth child. And when she was 1, she had her MMR vaccination, and she that evening became unresponsive and went into seizures. And so because of this, I called 911. She was turning blue. She was lethargic. It was a very scary situation. And she was put into a medically induced coma that lasted several days. We almost lost her. Very, very scary event for your 1-year-old. And it was determined that she did have an adverse event to the MMR vaccine. So that's my why. I wonder what your why is. I know a lot of us in this profession are doing this because of our own experience, either in Western or Eastern medicine. And so I always wonder, what is your why? And so if you want to type in the chat box what your why is, I'd love to see that as well. So that's a little background on me. Since having those experiences, having that experience with my oldest son anyway, I decided to become a biomedical engineer. I wanted to fix his brain. I wanted to develop a brain implant that would carry on the neurological function that was lost when he was apoxic in utero. I worked on these devices, worked on brain implants for motor control. Also, I worked on neuroimplantable stimulators, little micro stimulators about the size of a grain of rice that could potentially reanimate paralyzed limbs. And so this really became my passion. I started working in the industry after getting my bachelor's and master's of science in biomedical engineering at the University of California. I got into clinical trials and device development. I worked on these and at some point decided, I do not want to implant my son with these things. They were very invasive. They were having a lot of complications. The industry itself had a lot of issues that I just, as a single mom of then 3 children, I decided that this journey needed to end. And my doctor of Chinese medicine had been encouraging me to study acupuncture because it was helping my son Joe so much. So I decided to take a few classes in Chinese medicine, really just as a hobby to see as a scientist, how does this work? I was very curious, but I took a few classes and just fell in love with the medicine. And so I just kept going. I received my master's of science from Dongguk University in Los Angeles, and then got my doctorate in acupuncture and Chinese medicine from Pacific College. I've been practicing here in Tucson for about 10 years. I helped create this practice, Envision Wellness. We're a thriving practice, and I enjoy every single day I come to work. I tell my patients Monday is my favorite day of the week because I love just being here and seeing the miracles that happen with this medicine. So that's just a little bit about me. If we now just dive in to this shingles presentation, I'm sure many of you are familiar with shingles. Name for scientific purposes, herpes zoster, right? Our common name being shingles. This comes from the varicella zoster virus, or human herpes type 3 virus. It's characterized by a painful rash. Usually it will create a blister, that could start to vasculate or ooze. Usually it affects 1 or 2 dermatomes. It can be more. I have seen more than 2, but typically it is 1 or 2 dermatomes arising from the spinal column. These rashes can occur in many different areas on the body. The most common being on the back. We see that quite frequently. Here you can see some examples of the rash. Again, very, very painful, burning, tingling, excruciating, as patients have described. These rashes can also be on the chest. We see that frequently. They can also be on the face. Hope you're not eating breakfast right now. That is a little bit of a gross picture there, but it can get really bad. And if it goes untreated, it can start to develop scar tissue and a chronic disease called postherpetic neuralgia, or PHN, which, again, if any of you have tried to treat that, it is quite difficult to treat. So the primary infection actually comes from the varicella zoster virus comes from the same virus as the chickenpox. And so most of us who are of the older generations did get chickenpox as a child. There has been vaccinations that have developed in the last 20 years. But the chickenpox virus, it comes on as a rash all over the body. This chickenpox virus will then go dormant. So it tends to go latent in mainly the dorsal root ganglia of the spinal column, but it can be in the cranial nerve, the autonomic ganglia in the gut. Also, it can go latent in astrocytes throughout the body. This virus, as it goes latent, it just kind of hides and waits for an opportunity to be reactivated and to rear its ugly head as a shingle. And so this typically will happen after age 30. It's less common in younger folks, but it has been becoming more common, which I'll talk about shortly. So this virus is reactivated by a number of factors. It can be reactivated by stress. It could be reactivated by exhaustion, overworking, overplaying. It can be caused by illness. Those that have diabetes are more susceptible as well. And it has been shown that there are certain vaccines, specifically to include the COVID-19 vaccine, that actually does reactivate the varicella zoster virus as well. So we're seeing more and more cases lately after these new vaccines have been developed. Also, we see it in immunocompromised individuals or those on immunosuppressants. So how do we get this? If you did not have the primary infection of chickenpox virus, you are more susceptible if you are in contact with somebody who does have active herpes zoster or an active shingles case. The contagious period, unfortunately, does start before sores start to form. And this is through inhalation of the droplets. So if there is anyone who is near you, if you do notice you have shingles, if there's anyone around you who did not have chickenpox as a child, they are very susceptible to inhaling this. And so it's really important that education gets taken to patients and to the public so that doesn't get contracted by those who did not have chickenpox prior to this. If you did have chickenpox prior to being in contact with this person, you do already have the antibodies and the immune response to fight it. So you are safer from not contracting that from the person directly. And so you have a little bit more leeway as far as interacting with that individual. This infection can also be transferred via the placenta. And so if the mother had chickenpox and she developed shingles while pregnant. That's okay. Because she does have the antibodies, the baby will be okay. It is not life-threatening. However, if the mother did not have the chickenpox virus, and this is a new case for her, that can be life-threatening to the fetus. And so treatment does need to be taken quite quickly. So how does the virus work? How does it express? And this, really talking from a very physiological perspective, there has been shown to be this protein, an immunoglobulin called nectin-1. This nectin-1 immunoglobulin has been shown to facilitate the entry of the herpes virus. It's like glue for cellular adhesions. So when nerve cells come together and they're trying to interact with each other, there's this protein or immunoglobulin that helps them to combine. And nectin-1 is one of those immunoglobulins. This immunoglobulin is in a lot of different medications and vaccines. Pharmaceutical companies use it to help the vaccine or the medication to be present at the nerve cell, to be able to cross that blood-brain barrier. So this nectin-1, I would encourage people to watch out for, to read labels in the vaccines that you're going to take or in the medications you're going to take, to see if this nectin-1 is part of the immunoglobulin presence, because it has been shown that this nectin-1 does foster the viral entry, and it's been shown that there are more folks with an increase in this nectin-1 that have developed the herpes zoster virus than those who have less nectin-1. So that's just something to think about. Once the varicella zoster virus enters into the nerve cells, it infects the neurons and it starts to express itself, and it starts to generate proteins. These proteins start to replicate in the neuronal cell bodies, and then strands of those cell bodies of the virus actually sheds from the cell bodies. It sheds and travels down the nerve to the dermatome that it's associated with. So, for example, if the dorsal root ganglion in the cranial nerve, in the cranial vertebrae of the neck, is where it's gone dormant, then it will be reactivated and likely start to cause shingles around the neck and into the face. This virus promotes inflammation and blistering or vasculation of the skin, and that's when you start to see sores develop. The pain associated with this inflammation of the nerves is quite significant. If you've treated anyone with shingles, they are in absolute agony. So definitely something that you want to treat as soon as possible. There's quite a number of folks who do contract this yearly, approximately 1 million individuals per year in the US. That number has actually increased quite dramatically. That number, I believe, is from pre-2019. And we see that in healthy young individuals, that number is less than in those over 65. So those who are, say, in their 20s, healthy, they have a less likely incidence rate, about 1.2 to 3.4 per 1,000 people. After the age of 65, it's more like 4 to 12 per 1,000 people. So it does become more prevalent as we age, as our immune systems weaken. And there was a 2019 study that evaluated incidence from 2011 to 2016, and that came out with a group of people over 50 who had an incidence more like 10 per 1,000. They suggest that there was 8.2 about percent of those people who had some severe complications, 0.8% who were hospitalized. And there are deaths that are associated with this as well. So how does it work? There's 3 stages of this disease. First being the pre-eruptive stage. This is 1 to 3. They feel a tingling or a really intense burning, and there's nothing there that would indicate that that should be occurring. So at first it could be just this innocuous pain that seems like it's coming from nowhere. Also, they could experience headache, they could experience some fatigue, even some body aches, like they're having some flu-like symptoms. They may also experience photophobia. This is the stage where I really try to get my patients in to see me immediately, because if we can treat them at this stage, we can prevent the blisters from developing at all and prevent any kind of chronic issues or complications associated with herpes zoster. So in that 1 to 3 days, as I had mentioned, they are actually contagious to those who have not had chickenpox previously. And so anyone who is around them, especially any pregnant women or immunocompromised individuals who had not had chickenpox, should really stay away from them. If they have to come in contact, then they should wear a mask, gloves if they're going to touch them. So that is an important point. After this pre-eruptive stage, and blisters do start to develop, this is called the acute exudative stage. It is the most contagious stage. It can last for upwards of 4 weeks, sometimes more, but these blisters will develop. The vesicles or blisters can burst, they can ulcerate, and they will really attack the skin along those different dermatomes that it originated from. So that could be on the back, the face, the chest, even in the groin area, in between the buttocks. These blisters will be quite painful, burning, and eventually they will dry out. So if nothing is done, the course will run itself, usually on its own. But there is the potential that it will develop into a chronic, really debilitating pain that's called postherpetic neuralgia. This would be after the 4-week mark, where the blisters have dried out and scabbed over. But this elicits some very severe, sometimes lifelong pain that's described like burning or hot pokers being stuck into them. It can also cause paresthesias, numbness, shock-like sensations. For the folks that I've treated with PHN, it's brutal. These people can become suicidal. They typically will be quite disabled. They won't be able to work due to the pain. And of course, there's varying levels of this. But at the stage that people are in this excruciating pain, like I said, they're just miserable. So there are some different patterns of disease that can develop. One that is quite an emergency is herpes zoster ophthalmoscus, or HZO. This attacks the trigeminal nerve 5. And it can, then the sores can develop inside the eyes itself. This is an emergency, and they should go see their ophthalmologist as soon as possible. And I have some statistics here. So you can see that 50 to 85% experience some sort of complication associated with these sores. They can develop a conjunctivitis, they can develop a retinitis. It can affect their vision long-term, and this is why it is an emergency. The risks would be, like I said, blindness, corneal inflammation, visual impairment that's coming from that inflammation. And these folks are actually at an increased risk to having a stroke or a heart attack. So it can be quite serious. There's a lot of blood that goes to the eyes. And so if it gets to the eyes, this can be quite a risk of it traveling then through the bloodstream. Some risk factors for this are those who contract herpes zoster over the age of 50. Also those who are being suppressed, their immune systems are being suppressed due to other issues that they might have, cancer or rheumatoid arthritis. If they're on an immunosuppressant, this could be a pattern that would develop with them. Another pattern, and these are a little bit less common than the ophthalmologic syndrome. So Ramsay-Hunt, a disseminated herpes zoster, a deeper herpes zoster that can affect internal organs, a purpuric herpes zoster. This can develop into vasculitis under the skin and can also be life-threatening. Central nervous system herpes zoster. This one especially we see in immunocompromised patients, AIDS patients, cancer patients, those on immunosuppressants. And the central nervous system herpes zoster, this is an interesting one because it can really affect somebody's mental capacities. They can go through a lot of confusion and even personality changes. This can also cause stroke and other infarcts in the central nervous system. So again, those can be quite serious, but they are less common. The most frequent complication that we see with shingles by far is postherpetic neuralgia. And I've talked about that, but I'd say about 20% of patients that I've seen with herpes zoster do develop postherpetic neuralgia if they do not get treatment, and types of treatment they are or are not getting, and how they're taking care of themselves, what their stress levels are in their life. This can develop into a mechanical allodynia. So if you're familiar with the term allodynia, that's where anything that brushes against the skin can cause just excruciating pain. So it becomes difficult to even wear clothing. Also, they have an issue with regulating the body temperature. So they may always feel like they're just burning, and then that might alternate with feeling very, very cold. So again, thinking about our Chinese medicine, that yin-yang balance is trying to occur in these patients where they're having this extreme heat and then that's cycling into the yin and turning into an extreme cold and then back and forth. Postherpetic neuralgia, like I said, is very difficult to treat. A lot of different medications do not work for the pain associated with postherpetic neuralgia. You may see patients that are on gabapentin. That's very, very common to help to deaden the sensation from the nerve cells. I found that really doesn't work in what I've seen in my experience. Also, patients have been prescribed Lyrica. I have seen that to really not be effective. Patients have been on opioids to no avail and become addicted to opioids because of that. So a lot of different medications that are tried on the pain realm that just really don't seem to work. And that's why these patients really are just quite miserable. Some more rare complications that you might see are meningitis, which could be quite severe. They could have obstructions in the colon, which again could be quite severe. They could develop keloids, vasculitis. They could also just have recurring herpes zoster. So they get it and then they just keep getting it. Another complication that we're seeing now after our COVID-19 pandemic is the reactivation of the varicella zoster virus after contracting COVID-19, also after getting the COVID-19 vaccinations. And from what is being reported and what I've seen, the more boosters that a person gets, the more likely they are to develop this herpes zoster. Some statistics for you, approximately 7,000 individuals who had COVID-19, according to the European Vigilance surveys, contracted the varicella zoster virus actively. And then as of 2023, with our own VAERS system, they approximate there's over 10,000 reports of individuals who contracted the varicella zoster virus after getting the COVID-19 vaccinations. And I'll just give you a caveat to that information that most of these cases go under or not reported at all. And so there was a British Medical Journal study that was showing that the VAERS system, of course, it's very unreliable because this is a self-reporting tool. It's been shown that for every one case that's being reported to VAERS, there's actually 200 cases that are not being reported. So if you think about these numbers and you look at that 10,000 that were reported, and you multiply by that 200, that is a significant amount of people who could have developed herpes zoster due to the vaccine. There's also a number of studies, and I've listed the references there, that have found that all the available vaccines for COVID-19 have been found to potentially reactivate the varicella zoster virus. So I have a question in the question box asking, is COVID reactivating herpes zoster, or is it eliciting a new infection? So the answer to that would be that, it is reactivating the herpes zoster virus. Thank you for that question. Also, another thing that has been shown to reactivate the varicella zoster virus or herpes zoster are biologics. So those that treat autoimmune disorders like psoriasis, rheumatoid arthritis. These biologics, again, a lot of them probably have this Nectin-1 ingredient as an immunoglobulin. And so they have also been shown to reactivate the herpes zoster virus. So when we think about how it's being treated from a Western medical perspective, really, they don't have a lot to offer, unfortunately. There's medications that have been shown to help slightly. These would be some antiviral medications like acyclovir. However, these medications, as most of you probably know, are quite toxic to the kidneys. So these antiviral medications should not be taken long-term. They should not be taken with anyone who has any stage of kidney disease or those who are on other medications that also affect the kidney. It can be quite toxic for these individuals. And they really don't help to eradicate the virus. They only help to calm it down, help it to retreat back into the spinal nerve tissue. If the sores on the individual become infected or inflamed, they might be also prescribed steroids, which again has a lot of side effects, to include renal toxicity is another side effect. Also, steroids have a number of side effects like anxiety causing aggravation, retinal detachment, other infections, weight gain. So steroids, again, shouldn't be used for long-term either. And typically these medications are given too late. So in Western medical treatment, they may not get to the patient until after these blisters have started to develop. And at this point, they're already, those proteins have already been disseminated, and the viral load is already quite high. So it becomes difficult to treat with these antivirals. If they were given at the very, very early stage, before the sores develop, they may have a better chance. But it, again, can be quite difficult to treat. And most, if they're just seeking Western medical treatment, developed vaccines. So there's Zostavax and Shingrix. Those vaccines, again, have some pretty significant issues associated with them. When looking up the statistics from VAERS on the shingles vaccines, and these, I did a search on all of the vaccines for shingles. And as a whole, and again, this is, I'm sure, very underreported, but there's been to date, and this is as of July 21st of this year, 300 deaths associated with the shingles vaccines directly, 762 individuals with permanent disability, 559 that had life-threatening situations, and close to 6,000 who had serious injury due to the shingles vaccine. And I bring this up not because I don't like vaccines. I vaccinated my children. I had the issue with my daughter. I definitely don't consider myself an anti-vaxxer, but as a biomedical and biochemical engineer, and as someone who helped to develop medical devices and diagnostics and pharmaceuticals, I know that the method of research for developing vaccines is not the same. It doesn't have as much rigor as our regular pharmaceutical drugs. They get to market very quickly. They're not well tested. And it's like they're experimenting on the population, really, to be honest. And so it is concerning when patients just, I'm going to go get my vaccines, and they're really not aware. They don't have proper informed consent of what could happen to them because of these vaccines. And so this shingles vaccine, and looking at these VAERS numbers, again, if you multiply these by 200, because if you consider that VAERS, the statistical reporting is very, very limited on just people who are voluntarily submitting this data, the numbers do jump more significantly. I have another question in the chat box. How many total vaccinations does this cover? So when looking at the VAERS statistics, the shingles vaccine, this covers the Zostavax, the Shingrix, and then unknown. So mainly they describe it as that it could be either one of them. And so it or another. So I'm not exactly sure the answer of how many total. I believe it's 3 different categories though. All right, moving on. So when I see patients with PHN, I feel so sorry that I did not get to them at the shingles stage. And I do try to educate my patients that are coming in for various things about our ability to treat a wide variety of things. A lot of patients come in for pain syndromes, right? That's the number one thing that we treat as acupuncturists, I say, unfortunately. Unfortunately, because our medicine is so superior at treating so many different chronic issues, and so many people just don't know about that. So part of what I do in my practice quite actively is educate my patients about all of the different types of things that we can treat. And patients will come in, my brother has high blood pressure, and he doesn't want to take his medications anymore. Is there anything you can do? Because the medications are making him tired and lethargic, and he just wants to sleep all the time. And so the answer is absolutely, that's something that we can treat, especially with herbs. And so I hear this over and over again. Can you treat, XYZ? And my answer is always like, yes, of course. Chinese medicine is a complete system of medicine dating back thousands and thousands of years. It has lots of time for scientific discovery and tailoring to the individual. It can be quite superior at chronic disease because we get at the root of the issue, and we can treat that root while treating the symptoms to have really effective long-term results that does not then require long-term chronic care. for example, being on high blood pressure medication for the rest of your life, as opposed to taking a round of herbs for a couple of months and then having that blood pressure be regulated. So I try to educate people about the fact that we can treat shingles. I've had patients who try to cancel appointments because they don't want to come in because they have developed shingles. In that case, my staff's instructed to tell the person, absolutely, you should come in. And then we take precautions. If there's anyone in the clinic who has not had chickenpox and they do have an active herpes zoster virus, we'll take those precautions. But absolutely, I want them to come in as soon as possible. I've also had a number of patients who have come in with after getting the shingles vaccine, and they have had some long-term complications due to that. I've seen a lot of really strange neurological issues where it seems like they've had a stroke, but they haven't, or they have a lot of numbness and polyneuropathies, and they're not diabetic and there's no other reason for it. And it was after getting the shingles vaccine. I've seen a lot of patients where they got the COVID-19 vaccine and the Shingrix or shingles vaccine pretty quickly in relation to each other, and they've had a lot of significant issues. And so I feel very passionate about trying to educate people that it's their choice if they want to take the vaccine or not, or if they want to come and get treatment. And for Chinese medicine, that is an option for them, that they should ask questions about these vaccines, that they should ask questions about the ingredients, they should ask questions about the side effects, the potential side effects, and that they should report the side effects that they do have if they do decide to get it. And of course, I'm supportive of them, of all patients, no matter what they choose to do. If they want to get the vaccines, great. If they don't, great. I support them either way. But I do want them to know that there is another option, that there is an alternative that is very effective in treating shingles. And so once patients learn that, I've had a number of patients who had issues with the first shot, the first vaccine for shingles, and they come in and they say, I really don't want to get that second shot because it is a 2-shot vaccine. And I educate them on what we can do, and they decide not to get the second round. Or I have folks who their partner did get it, they had issues, and they're debating on getting it or not, and they decide that they're not going to get it. So how do we look at this from a TCM perspective? I see this and I treat this from a Shanghan Lun perspective, the 6-channel theory of Taiyang, Yangming, Shaoyin, or Shaoyang, Taiyin, Shaoyin, Duiyin. And I'm sure most of you are familiar with the 6-channel theory and how that works as a pathogen enters into the body system. It first has to penetrate the Taiyang. It has to penetrate the lung and large intestine channels. That's when we get our first signs, our wind cold, our wind heat, where we will get the sneezing or the flu-like symptoms, the maybe sore throat, backaches, neck ache, alternating. We could have fever, we could have chills. That then will go a little bit deeper into the levels, into the Yangming, and it could start to affect digestion. They could have a very severe fever at that point. And then after going through the stage from Taiyang to Yangming, it can go into the Shaoyang, which is the in-between, right? So the Shaoyang stage, the pathogen can go more internal and it can go more external, and it can fluctuate between the two. So you have alternating fever and chills. You may have a virus that then goes dormant. And this is how I see the varicella zoster virus or the chickenpox virus. It starts as a Taiyang, it goes into the Yangming, and it gets subdued. It starts to run its course. and then it enters into the Shaoyang stage. So it will go dormant, as I've described from a Western physiological perspective, into the dorsal root ganglia. And at this point, I would say that it's at the Shaoyang stage, just waiting to be reactivated. It's this unresolved Taiyang syndrome that starts as typically a wind cold to wind heat, goes internal, then it's reactivated and it comes back external. And it can then fluctuate between internal and external. And this is why we have reoccurring cases of herpes zoster. So from a TCM perspective, what is triggering this activation? So we've talked about stress being a factor. We've talked about exhaustion or overdoing things being a factor. So what does that look like from a TCM perspective? So stress, as you know, can cause qi and blood stagnation. That qi and blood stagnation, if left unchecked, can lead to heat. It can start to deplete the body of its yin, which can then further activate more heat. We also have the deficiency side of overworking yourself, overplaying, not having enough sleep, not being nourished properly. This then leads to a qi and yin deficiency. That qi and yin deficiency can then also promote qi and blood stagnation. And this can just become a vicious cycle of stagnation and deficiency, playing on each other. And at this point, this is when I believe that the virus is reactivated, then causing a lot of heat syndrome complications. So the virus is then activated, and that turns into a heat or fire in the body. So from a TCM perspective, this heat, when we think of this heat in relation to herpes zoster, we can see this in two different forms, really. One is toxic heat and the other is damp heat. And really, to distinguish between the two, there's just some very fine details to think about. And in the initial stages of treatment, it's not going to matter all of that much if you don't differentiate exactly between toxic heat and damp heat. You're going to get a better effect if you do, but you'll be able to treat this from a purging fire perspective regardless. So in the toxic heat case, you'll have this burning sensation on the skin. They may have more of a sharp pain quality. Whereas in the damp heat, they may have more of a tingly sensation or an achy quality. It may start as more of an itching or tingling. They could feel more fatigued in the damp heat situation. They could be more lethargic. Whereas in the toxic heat situation, they may feel more irritable or agitated. They may not want to sit still. They may feel like they have to run around and they want to move. In the toxic heat situation, they're going to have a lot of thirst. This toxic heat is going to be burning up the yin very quickly. And so they will be very thirsty. Whereas with the damp heat situation, they may not have any thirst. This dampness might be preventing fluids to be circulated properly in the Sanjiao system. And so they may not want to drink at all. In the toxic heat situation and the damp heat situation, they likely have a red tongue body. In the toxic heat situation, likely they will have some cracks forming, or if they already have a predisposition to yin deficiency, they already have some cracks in the tongue. Those cracks will become deeper and more prominent and more numerous. In the damp heat situation, the tongue body might be more swollen. They might have scallops or teeth marks. In the toxic heat situation, there may be no tongue coating. The tongue coating might be burned off completely, whereas in the damp heat situation, the tongue coating might be very thick and yellow. In the toxic heat situation, the pulse will be thin and rapid. Whereas in damp heat, it might be, of course, still rapid, but more slippery. You might feel that dampness in the pulse, in that slippery quality. That might be more in the middle positions. And in the toxic heat situation, you might feel more of a thin pulse in the middle, or in the distal positions on the pulse. Just looking at my questions here. Good. I have someone who said they had to report Shingrix to the CDC and VAERS as it spiked her mom's liver enzymes so high, her primary have a liver biopsy. Yeah. Where MDs will tell them to stop taking the herbs. But really it was actually because of the vaccine that the liver enzyme spiked, because the patient will continue to take the herbs and the liver enzymes will come down because of course we have herbs that help to reduce liver toxicity and help the liver to function better, such as Long Dan Sao and Yin Chen Hao and Chai Hu, Huang Qin. Those are all great for herbs to help folks with elevated liver enzymes. I have another question. If I could talk about getting a Shingrix vax after a case of shingles and or before a COVID booster. Not sure what you're asking in that question. I've definitely in my experience seen that those that have a Shingrix vaccination and a COVID booster, within a month of each other, they have more complications and more severe complications than if they were to wait. If they are really intent on getting those vaccinations, I would ask them to get them at least 6 months apart from each other, or to pick one or the other and wait. Getting a Shingrix vax after a case of shingles, I've seen people do that because they get scared with the shingles. And so then their MD convinces them that they should definitely get the vaccine, the Shingrix vaccine. And if you have, there's more to that question, feel free to chime in on the question page. All right, let's see, going back to our PowerPoint here. So when looking at these individuals, and we know that there's some heat in the body, some fire, we also want to take a look at what organ systems are being affected. Typically, you'll see that the lung and large intestine channels are being affected. So they may have a floating pulse in the right distal position in the lung pulse. You might feel that because the virus is going more external in the Xiaoyang stage. Is coming to more of the Taiyang. They may have an aversion to wind. They may also have more constipation due to the involvement of the large intestine and that heat burning up fluids once again. They likely will also have involvement with the liver and gallbladder. Of course, due to the qi stagnation that then develops into heat, we see this happening in the liver organ system, accompanied by the gallbladder. So they may have a more wiry pulse in the middle section. Their stool might be more bitty, again, with some constipation. They may have a weird bitter taste in their mouth. That's a very common complaint of patients. Also, the spleen stomach might be involved. In this case, they may have a weaker pulse in the middle positions. They may be experiencing more of a loose stool or diarrhea. Once it starts to affect the spleen stomach, this may be more of the damp heat than the toxic heat situation. Also, they may be experiencing a lot of fatigue. They could have more achiness, bloating, indigestion. And then if we look at the kidney and bladder involvement, They may have more of a deep and weak pulse in the proximal positions. They may have a lot of urinary frequency or urgency, again with the fatigue, because their qi and yin is being depleted by this heat. And so they may complain more of a burning sensation on their skin, with irritation in the bladder. They may feel like they need to urinate more than they actually do. And they may just have a dribbling of urination and feel like they're really never completely eliminating the urine. It's also very common, especially in the over 65 population. So from a TCM perspective, early treatment really is key. As I had mentioned, if we can treat them before these sores erupt into a vesicule, into a blister, we will be able to treat this very, very quickly. I myself have had a couple of bouts of where I felt a shingles starting to occur. Having 5 children and being single and owning a business and having a child with special needs that has, we have caregivers around the clock, I have a lot of stress in my life, right? And I tend to deplete myself. So I have to be careful of that. But because of that, I have myself felt this tingling, burning sensation on my skin. I've felt myself being achy, being adverse to wind, being fatigued, having a strange headache. And so I treat myself immediately with herbs, and literally within 6 hours, that's gone. Within 1 or 2 doses of herbs, I can usually eliminate that very, very quickly. And I've also seen this with patients. So if they come in this early stage before the blisters have developed, we'll do some acupuncture. I'll give them some nutritional recommendations, give them some herbs, and tell them to come in the next day. And by the next day, they're fine. Same with patients who come in at the early stage of blisters. So they may have already redness appearing. They may already have a sore forming, or multiple sores forming. If they can get in as soon as possible, at the first sign that they notice, even at this stage of blistering, typically within 24 hours, their pain will be gone. They can, the blisters will start to retreat. They may have a little bit of redness that takes a few more days to dissipate, or if they had a sore, it might go through the full stage of ulcerating and drying out, but they don't have the pain associated with it. And then they also don't scar or form any kind of chronic issues like postherpetic neuralgia. So again, early treatment is key if we can get them as soon as possible. And that really does require educating your patients to come in as soon as they feel any signs and explaining to them what those signs are. If they can come in right away, we can likely treat them very, very quickly. The longer that they wait, the longer it's going to take. And if they come in at the stage after 4 weeks and they're already starting to develop PHN or postherpetic neuralgia, it becomes a lot more difficult to treat. Still doable, especially if it's at that 4 to 8 week mark. But I've had patients who come in years after having the initial shingles, and they've had postherpetic neuralgia for years. Those patients are very difficult to treat. And if anyone wants to shout out of their experience with treating postherpetic neuralgia, I'd love to hear that also, because that is something that is, like I said, difficult to treat. And these people are just in agony. They're willing to try anything. I've had a patient that was so miserable. He went through all of the different courses in medications for postherpetic neuralgia. He He tried the gabapentin, that didn't work. He was on the opioids, which he did not like. He was put on Lyrica, and he started having hallucinations, and he did not like how he felt on that. He then tried a stimulator, like a TENS unit. That didn't help. He was getting acupuncture. He was taking herbs. He was following the nutritional recommendations. We did all types of, we did plum blossom needling. We did bleeding cups. We did electrostimulation. They pulled out all the stops, tried everything, but it had been a decade for him that he had postherpetic neuralgia. He then went on to have an electrical stimulator implanted into his body. And he came to me because that was my specialty in biomed, was implantable neuromuscular stimulators. And he asked me if I thought this would help, a spinal cord stimulator or a peripheral nerve stimulator. And I said, no, I really don't think it's going to help. We've done the electrical stimulation and that didn't help. So I don't think it will help. He went ahead and had the implantation done. And he came back to me a few months later, just beside himself, telling me he wished he would have listened to me. He has more pain now that he had these stimulators implanted. And then they wouldn't remove them due to the insurance situation. They would not remove the stimulator. They would not remove the battery pack that was in his hip. This battery was starting to come out of the skin in his hip. So he has so many more issues because of this PHN and because of the lack in Western medicine of treating it and of having just such a difficult time. He just has really fallen down a rabbit hole. He reported that the most relief he ever got was coming in to the clinic to get Chinese medicine, and that's the most relief he had ever had. But it has been quite difficult with this patient. So that's just one case. And I'm seeing in the chat here that the PHN seems to respond to the 7-star hammer or the plum blossom needling. That does really help. I've seen that work well. I have someone else here saying that she had great results using evergreen herbs and threading the ribs, T through T8, opposite side liver points. I have someone else who said St. John's wort oil or minor PHN. And I've had great results with some patients with PHN as well. But just pointing out that it is much more difficult to treat. And sometimes it is not treatable compared to treating shingles. Treating the shingles is so much easier and it's so much more quick and effective. So really, I would like to try to get to folks before they develop the PHN and try to educate folks before they get to that level. Thank you for those comments. I'm just going to check the questions here. Can I treat patients as I had shingles last year? Yeah, absolutely. As long as you don't have an active case. And again, of course, most of all of us have had chickenpox or have had the vaccine for chickenpox, which also still makes you susceptible to herpes zoster. But so we all have this virus, likely all of us have this virus dormant in our nerve cells. And so absolutely you can treat patients if you had shingles a year ago. If you have active shingles, you probably don't want to see patients, or you need to ask your patients if they've ever had chickenpox before seeing them. I would think that if you had an active case of shingles, you wouldn't want to be seeing patients anyway. All right. So how do we treat from a TCM perspective? There is a multi-phase approach that I take in treating shingles with my patients. First, I treat the symptoms. So we want to clear the toxic heat. drain the damp heat. This is always first. We want to make sure that we're clearing these symptoms and helping them in the very moment, because as we know, toxic heat and damp heat, we don't want to treat any deficiencies at this point. We don't want to nourish any kind of toxic heat in the body. We don't want to nourish the damp heat. We need to drain that quickly. We need to clear that immediately. After doing that, I recommend treating the root, which means harmonizing the Shaoyang. And so we have specific formulas and protocols for harmonizing the Shaoyang. And then finally, we'll treat the constitutional imbalances that may have brought about the reactivation of this virus in the first place, or the imbalances that have occurred due to the toxic heat and damp heat draining the body, burning up the fluids. So we may need to treat the effects of the actual virus reactivating itself. Now, if we do have patients who are more severely deficient in qi or yin, we may need to swap the second and third stage in the approach. So if they are quite deficient, then we may need to treat those constitutional imbalances before harmonizing the Shaoyang. It might be just too much draining and purging for them. And so you want to take that into account when you're treating your own patients of, is this person going to be able to sustain this approach? Will it cause too much fatigue? Will it cause too much of an imbalance in the qi and yin, where they may experience more headache, for example, or maybe they'll experience more constipation or more diarrhea or more bloating, more issues with their skin. Maybe they are so dry and so deficient of yin that their skin is flaking and peeling. We really might want to reevaluate to treat those constitutional imbalances prior to harmonizing the Shaoyang, just so that we're not draining too much of their qi and yin. Okay, any more questions or comments? I have a question. Should we be equally concerned with children who have received the vaccine in terms of exposure to an active case? So theoretically, if they've had the chickenpox vaccine, they have been, their immune system has been exposed to the chickenpox virus. So this should help them to be protected also against folks around them who do have active shingles. And it does depend on, that's kind of a difficult question to really know. Typically 2 doses of the vaccine for chickenpox, the varicella vaccine that children get, are recommended. 1 dose can prevent 95% of the disease. So if there's some questions, did they have both doses? How long ago did they have those doses? But because it is a live vaccine, to my knowledge, that it is a live virus, they actually do have some protection, because they have had that live virus put into them, and so their immune system has been able to develop the antibodies, and so they do have the immunoglobulins that they need to help, and so they have been basically exposed to that virus. Good question. I have questions. Will I go into the herbal formulas? Yes, I will. Okay. Any other questions at this point? Okay. Okay, I have one more question. If you had a really severe shingles attack in bed for over 3 months, a year ago, no drugs or shots, herbs and homeopathics. Do I have any thoughts on a reoccurrence? Yeah, really anyone who has had a shingles attack is susceptible to a reoccurrence, no matter how severe it is. So you could have a severe case of shingles or a not severe case of shingles. In both situations, in all situations, there's definitely a potential of reoccurrence. And that's why I recommend seeking Chinese medical treatment, of course, so that there is less likely, if we're keeping these patients in balance, they are less likely to have a reoccurrence. And we'll go into that shortly here, but the idea of Chinese medicine is to create balance in the body system, right? So if we are in balance, then our bodies should be able to protect us. And as we harmonize the Xiao-Yang, this is like clearing our body of that virus. So we are helping the body to be less likely to have this reactivation. Another question, 77-year-old had a medium case 1.5 years ago. Would you deter him from the vaccine? PHN went away. I try to let patients make their own decisions because it is kind of a controversial subject to promote not doing vaccines or to promote doing them. Either way, I like to just give the information. So in that case, I would offer the education that we can treat shingles very effectively as soon as they have any feelings of shingles coming on, to come in, or to even if they can't come in the office, we can do telemedicine and they can share their tongue with us and we can prescribe herbs. A lot of times, if I have patients who don't want to come in, or I have patients who don't live in Tucson, right? So they will want me to send herbs to them, or they will have a family member come and pick them up for them. So really in educating them that we have options, and then outlining the risks that they are taking with the vaccine and some of the numbers, because people really aren't exposed to this from their medical doctor when the nurse is coming at them with this shot. They're a lot of times not getting proper informed consent of what to expect, what side effects could occur, and what those statistics are. And so sharing the statistics, sharing some of the types of injuries that can occur from the vaccines, that can help them to make their own best informed decision. So I wouldn't say that I would deter him from the vaccine, but I would give him information, him or her information, that would help them to make their own decision. Now, of course, I come from a bit of a biased standpoint, in that I believe our medicine is superior to giving these potentially fatal vaccines. And I will try to remain neutral, but I do come from a biased perspective. So they know that, you know, and I will let them know that I wholeheartedly believe in this medicine and what it can do for them, and that I've experienced it over and over again, of it working. And so typically this is enough for patients to make a decision, and most patients will decide not to do the vaccine that I've talked to, even if they have experienced it and are very fearful of it. They do want to hear the alternatives. All right. Let's see. I have a question. How do I reach out to you in case I need telemedicine with you? If need be, could you share the details? Yes, absolutely. At the last page of the slide, I have all of my contact information, and I'm always here and available for patients and for you practitioners. Really, my goal in being here and in general is to advance this medicine and to help the practitioners to be more successful. Because I really think that our medicine is going to explode in the United States with all of the issues that people saw during the pandemic, all of the issues that are being elucidated now with the COVID-19 vaccines, and you know, people's awareness of what big pharma is doing right now, and all the lobbying that they do, the control of media that they have. I think that more and more people are awakening to the fact that the pharmaceutical industries really are about making money and not necessarily about helping individuals. We have quite a sick care system right now where these medications have a lot of side effects, the vaccines have a lot of side effects, and then they develop a medication to help combat the side effects. And before you know it, I mean, how many of you have patients over 65 that are on like 12 different medications? And so this just is such an epidemic right now in our country, that our population is just so unhealthy and over medicated. And I think more and more people are coming to realize that there are alternatives out there. And I think it's our job to really help educate the people that there are alternatives out there, and that we support them. You know, we support what they want to do, but we are here for them also when they want to seek out an alternative. I think that this is going to be very, very important in the next 5 to 10 years. And I think that our medicine is going to really explode. So absolutely, I'm always here for you guys. Okay, so let's dive into some treatment strategies. So first up, I want to talk about declaring toxic heat in the large intestine and lung. Now, thinking about this from a perspective of they've come in for treatment very early on. And so you're seeing them before any lesions are present. They're just coming in, complaining of a burning on the skin. And, you know, they may not know that it's shingles about to develop. They just have a weird sensation on the skin that's not explained. And they may ask you, if it's on the back, they may ask you to look, do you see any sores? Do you see anything? And there may not even be any redness. There may be redness from them trying to itch at it or trying to get to it, but they may not have anything present at all. Again, this is the most easiest stage to treat. I've seen success, like I said, within 6 hours, 12 hours, just really remarkable, and lesions don't ever develop. So if we can get our patients in to see us at this point in time, that is the best. So in this case, we're clearing toxic heat from the lung and large intestine. I recommend some acupoints to help to clear this heat right away. So I would do a large intestine 4 combined with large intestine 11. And if we go opposite the channel, so starting with LI11, going to LI4, we're promoting draining the heat from the large intestine channel with those points. I would combine that with a lung 10 and lung 7, again, going against the channel. So starting with lung 10, here at the thumb, and then going to lung 7 as the next point to help drain that heat from the lung. Also, I like to use a technique of threading from liver 3 to liver 2. So combining Li4 with liver 3, of course, is great at moving qi, which I'm sure we all know. But if we use that combined with threading that to liver 2, that can help to clear the heat from the body itself. And we get that qi movement as well by using the liver 3 combined with the liver 2. Also, I recommend using Sanjiao 5 in combination with gallbladder 41. This combination helps to clear the yang ming. It helps to also harmonize the Xiaoyang, and really we'll be getting to harmonizing the Xiaoyang, but I like to start right away with some harmonization so that the Sanjiao system knows that we're coming for it, right? So we're clearing the heat, but we're also addressing that we are going to react to this Xiaoyang internal, external complication that arises. And then combining gallbladder 41 with gallbladder 20, again, going opposite the channel direction. So starting with gallbladder 41 and going through GB20, this can help to extinguish that wind from the Taiyang through GB20. And that is in combination with lung 7, of course, which also helps to extinguish that wind. But GB20 is also great at clearing heat and clearing heat in the gallbladder channel. So if we start at 41, way down on the foot, and then needle at GB20, that's going to promote the heat to be flushed throughout the body. All right. Then another way of clearing heat is we can do some cupping. Cupping is a great way of releasing toxins from the body, releasing heat from the body. I'd recommend doing a bleeding cup at DO 14. So you can take a lancet and prick many times around DO 14 and directly on DO 14, and then add a cup, leave it on for 10 minutes. When doing this, I've seen some pretty interesting blood that's come out. The blood might start bubbling as it's coming out. It might start steaming. It might coagulate very quickly, and you'll get a very thick, dark, viscous type of blood that comes out. All of these things would indicate that this was a good thing to do. If we are not getting much blood, or it's very thin, or it's a light red color, then I might not do this again. That might be an indicator that the acupuncture was enough to release the heat, and that they don't need additional cupping. So I like to start with that. And then we could, if they're very adverse to needling, or if they're very sensitive patients, maybe you don't want to do the bleeding cup, then I'd recommend doing cups at UB 13 and UB 25 as well. So you could do DO 14, UB 13, UB 25 to help clear the toxic heat from the lung and large intestine channels specifically. I would do these bilaterally in the UB 13 and 25, so a cup on either side with one at the center on DO 14. As far as the acupuncture goes, I personally like to leave one hand free, and so when I've done needling in cases like this, I will do the Li4, Li11, lung 10, and lung 7 only on one arm or another, not bilaterally. But then the rest of or in Sanjiao 5, and then the rest of the points I would do bilaterally. So do unilateral for Li4, Li11, lung 10, lung 7, Sanjiao 5, and then bilateral for liver 3 to liver 2, GB41 and GB20. Question, needling first, then cupping. I typically will do the needling first and cupping second. I think either way is okay though. If you wanted to do the cupping first to release some of that heat, if that could be more indicated, especially if you have a patient who's very agitated, who has this heat that's really like affecting their mind, or they are very irritable, or they're very needle sensitive, then I would do the cupping first to help release some of this heat first. And that could help to really calm them down, calm that irritability aspect by releasing some of that heat first through the cupping, which is typically not seen as a painful thing. And in that case, again, I probably wouldn't prick to bleed. While I know it would be more effective for them, it's not going to be effective if they don't want to come back to see me, right? So I try to accommodate people's sensitivities as much as possible. Too, if they are more sensitive of a patient, typically they'll have a more effective result with less intervention. Typically, people who are more sensitive will respond to treatment easier and with more efficacy than those who say don't feel anything during treatment. And so for that reason also, I would not prick to bleed, because I think that it would just be too much for them. And I don't want them to be turned off to come back. So in those cases, you could do the cupping first. Again, if we have patients that are very needle phobic, and this really goes across the board. If I have a patient who's needle phobic or very needle sensitive, then I will start with ear shen men and ear sympathetic. So looking at, shed men in the ear and then sympathetic, I would put those points in first and give them a couple of minutes with those points to help their bodies just calm down. And that typically will help folks who, I've had a lot of needle phobic patients. They come in saying, well, there's no way I'm getting acupuncture because I'm deathly afraid of needles. I'll pass out, or I'll hyperventilate, or I'll just have way too much anxiety. And so I'll educate them that we do have specific points that help with that, and that we would do those first. I might start with an ear seed instead of a needle and use a seed and really stimulate that seed at shed men first and have them calm down. And then usually I'll put in a point that's pretty benign, that typically doesn't cause a lot of pain. Say in this case, LI11 usually isn't that painful. So I might do that point first to just kind of give them a taste. And at that point, almost everyone I've ever worked with in these cases will be okay, like go ahead and continue. And you just want to get it over with quick. Maybe give them an eye pillow so they're not looking at what you're doing as well. Right. Okay, so in this next case, lesions are present, and we'll get to herbs here in just a second. So the two cases of clearing the toxic heat in the large intestine and lung, one, lesions not being present, two, lesions are present. So now in this case, we can use the same general acupuncture points. At this point, though, I don't recommend doing any cupping. At this point, we want to do electroacupuncture. So we want to use our e-stim machines. And how we do this, if you have your unit handy, if not, I would just do really strong needle sensation. But ideally you have the electrical stimulation unit. You'll put the positive lead, you'll put the positive lead in the most lateral, outside of the most lateral lesion. So if you look at this picture here, you can see that this individual has some lesions on the spine. They have some lesions over on between the spine and the scapula, and then some that go out over the scapula in the kind of SI, small intestine channel region. So you want to pick a couple of Asher points that will be the most lateral to the lesion. You don't want to put a needle right in the lesion, but you can put it at the very most lateral point. So at this point, on this individual, if you look at where the armpit comes into the shoulder, you can see that there's a lateral line that's outside of the lesions. I would pick a point there at the top of the highest point of the lesions. And then I would go to the lowest part of the lesion. So one that's, I'd say it looks like it's about 1 chun over SI10. And then lower down below the armpit fold, there's a lesion. So I would go at the lower point as well. So you'll connect your positive leads to those points. And then you'll use the extra points, Huatu Jiaji, at the spinal root level with the lesion. So in this case, we can see that this individual has lesions on the spine itself. So we'll want to go just above and just below where the lesions are on the spine. So those Huatu Jiaji points, if you're not familiar, they go right in between the spinous process of the vertebrae. And so when you're feeling the vertebrae, you'll go down to where you feel the hole on either side of the vertebrae. That's where you're going to put your needle for the negative lead. And you can use one side or another or both. Either way will work. I like to try to use both sides if you can, and then connect the lead to both of them. That can be kind of tricky. You need to use a longer needle that's a little bit stronger. So I wouldn't do that in more sensitive patients. I would just pick one side or another for more sensitive patients, typically the side that the lesion's coming out from. But you can use the opposite side if you need to, if the lesion's present on the side the lesion is, and you can't get to that Huatu Jiaji point from the same side, then you can use the opposite side as well. And you'll connect your negative lead at the root level of that lesion. So we have one positive lead at the top, about 1 chun above SI10 in this case, and then one over at the Huatu Jiaji point that's about, it looks like it's about T2, the thoracic vertebrae 2. And then the lower one will have a positive lead below the armpit there. And then the negative lead, it looks like it's about T5. And again, without feeling this, it's hard to tell, but when you're seeing the patient there, you can get a sense of where these lesions stop and start and what vertebrae you want to target. And with this electrostimulation, what you're trying to do and what your intention is, and why we're going from positive on the very lateral most aspect to negative in the spine, is we're trying to get the sensation, the inflammation, to retreat back to the spine. So as I had talked about in the etiology of the virus and how it, the pathogenesis of it, it starts to shed outward in the dermatome that the spinal nerve innervates. So we want to try to get the stimulation to make that inflammatory response retreat back to the spine. I like to use a mixed frequency. If you use a continuous frequency, we could get accommodation of the nerve. Accommodation is where the nerve is desensitized to the stimulation being introduced to it. This is a pretty common phenomenon. And so I like to use always a mixed frequency in these cases so that the nerves don't get accommodated to that frequency, but are really being given different inputs so that it's not a constant feeling that the nerve can just kind of get used to. So this mixed frequency, you can use 125. I use this higher frequency so that we're not eliciting muscle contraction, because we're not trying to elicit anything with the muscles. We're really trying to target the nerve cells. So 125 is a good strength. I mean, you could go 130, but I wouldn't go down to, like, say, a 10.5 or a 5.2. That would elicit too much of a muscle twitch-like response, and that's not the effect that we're going for in this case. And I use my mouse to show the areas. I don't know. Can you see my mouse here? Sure. I might be able to use a pointer. So, oops, nope, that didn't work. Use my pen tool here. Here's a laser pointer. Okay, can you see this now? So I would put one here. Let me just change this to a pen so I can mark it for you. So one about there, one there. So positive being here, negative being here. And then this one, I would do my positive lead about there, and my negative lead about there. Does that help? All right. Good, yeah. There's a question, if we only have the po-pinter e-stim, can we stimulate each point? I'm not familiar with the po-pinter? I'm not familiar with that. Oh, pointer. The pointer e-stim. You could. And if you are just manually stimulating, you would want to start with the positive and then go directly to the negative so that you're mimicking the retreat. And really, we're trying to cover this whole area. And so you would stimulate here and then at the Huatu Jaji points. You could go directly into the dew point as well. That would be an additional option if you wanted to. I found that the Huatu Jaji points really help to stimulate that spinal nerve, help to give input to that spinal nerve. And so I've had a lot of success using the Huatu Jaji points. But if you wanted to, you could experiment with using the dew point as well. And if I was manually stimulating, I might pick a few extra points. So I might do another point midway through. I might look at some of this area that's more inflamed, and I might do some extra stimulation outside of that. And then at the Huatu Jaji points as well. But with the electrical stimulation, it's a little easier to really get this whole area of all of the dermatome here by just using a surrounding technique. I would leave this stimulation on for the whole treatment. I like to treat for 40 minutes with them on the table, and I like to check on them midway through the treatment. So midway through the treatment, at about the 20-minute mark, I would go back in and ask them if they're still feeling the stimulation. A lot of times the stimulation sensation will decrease over time. So at that point, I might increase the volume, the strength. At that point, in some patients, the volume seems to get higher as you go. And so you'll just want to keep an eye out. If they are a more sensitive patient, you might give them a buzzer. You might stay in there to make sure that that stimulation doesn't become too intense for them. I have a question. Do you ever use laser devices for lesions or pain? I don't use laser in my office, so you could try that. But that's not something I've used. Let's see, any other questions? Okay, I think we're good there. All right. All right, now if they have more of a liver gallbladder involvement, I might add a few points here. So again, going back to patients where lesions are not present, and we're trying to clear toxic heat, but we want to focus more on the liver gallbladder aspect. If they have more liver gallbladder symptoms, more irritability, more heat, they might have a really flushed face. They might have more of that bitty stool or bitty taste or bitter taste in their mouth. In this case, I would add a few points. So I would still do the Li11, Li4 combo and the lung 10, lung 7 combo and the liver 3 to threading liver 2. But I would also add a liver 8. And that's the Hisi point. And so that can also help to drain heat from the liver. It also is helpful at soothing the liver qi and helping to harmonize the Shaoyang as well. So in this case, I would do liver 8 first and then thread liver 3 to liver 2. Still maintaining the Sanjiao 5 GB41 protocol. And then I would add a GB34 to help with qi regulation and more of helping to remove heat from the gallbladder channel. And so again, I would go from gallbladder 41 to gallbladder 34 to gallbladder 20. Same with the cupping. We can prick to bleed and do bleeding cup at do 14. I would still keep the UB13 because this is a virus that's trying to express itself externally. And that UB13 can just help with releasing that exterior. And then I would add UB18 and 19 to target the liver and gallbladder to release heat from those two channels. All right, and then if lesions are present, again, I would just add those points, liver 8, GB34. We're no longer doing the cupping. And now, again, we'll do the electroacupuncture, same idea, picking a positive point at the lateral edge of the most lateral lesion on at the top and bottom of the dermatome, and then picking a Huatu Jiaji point above and below where the lesions are present. And thinking about now toxic heat being affecting the spleen and stomach. So here again, lesions are not present. There's toxic heat in the body, and we're seeing involvement with the spleen stomach. So they have more loose stool or diarrhea or fatigue or bloating or indigestion, heartburn. They may be experiencing those types of symptoms. So we want to address those as well. And so here we have the same initial points that we used for our lung and large intestine, our Taiyang involvement. And then we're going to add a few points to help with the spleen stomach. So likely we're getting some deficiency. Maybe they already have a tendency towards qi deficiency. This is likely that this is part of the etiology for them, is that they were already qi deficient. And so now it's really attacking the spleen stomach because that's their weak area. And so we would want to add spleen 6 just to help nourish the qi a little bit. And stomach 36 to help with nourishing the qi and blood and the stomach and spleen channels. However, we don't want to tonify the heat, right? So I highly recommend that those would be some of the last points you would put in. So we're going to start with all of these heat releasing points and get that process going in the body before activating the chi tonification that spleen 6 and stomach 36 provides. And then with stomach 36, again, in the opposite direction of the channel, I would use stomach 44 to help drain heat from the stomach channel in conjunction with stomach 36. And then if they are experiencing constipation, I would also add stomach 37 and stomach 39. That will help to get the intestines moving and help with the constipation. If they have a lot of bloating, you might want to add stomach 25. That's not here on the PowerPoint, but that's an option. 4 doors, stomach 25, Ren 6, Ren 12 work very well at reducing bloating, even on the table. I've had a lot of patients experience this where I come in midway through or even at the end and they're like, I was so bloated and I just watched my stomach deflate on the table. And that's by using the stomach 25, stomach 36, and then Ren 6 and Ren 12. So 4 doors plus stomach 36. And in this case, I would add stomach 44 as well. So if you were doing that, you would start with stomach 44, then you would go to stomach 36, and then stomach 25, and then add Ren 6 and Ren 12. Now, if they have the constipation and you want to use stomach 37 and 39, you may not want to do 5 points on the channel. That's a bit much. So I would pick 4 tops. 3 is more ideal. So I might choose, depending on how deficient they are or are not. If they're very deficient, I might choose the stomach 36, 37, 39 combination. If they're not so deficient, if they have more heat in that center area, more redness in their tongue, then I would use the stomach 44, stomach 39, stomach 37 combination for constipation. So pick 3 or 4, don't use all 5. So don't use stomach 25, 36, 37, 39, 41. That would be overkill. It's just too much information for that channel. And I in my experience, if you use too many points on a channel line, then it kind of negates itself. So better to be more direct in your approach and give the body some very direct, distinct input. And then with our cupping, again, we would do a bleeding cup on DO14, a regular cup at UB13, and then add UB20 and 21 to help release the spleen and stomach channels. Somebody asked, what if you don't have an electrostimulation option? Yes, so just strong needling sensation. Again, starting with, if we go to the next slide, starting with the more lateral aspect, strongly stimulating at the very lateral edge, and then going directly to the Huatu Jiaji point and giving strong stimulation there. And then I would go to the lower point, give strong stimulation where the positive lead should be, and then back to the Huatu Jiaji point, giving strong stimulation at that lower Huatu Jiaji point. And then you could alternate. You can go back up to the top, and then to the Huatu Jiaji, back to the bottom, back to the Huatu Jiaji, and just repeat this. I would repeat this 3 to 4 times per 20-minute session. So if you were going to leave them for 40 minutes, I would do 3 to 4 strong stimulating sequences before leaving that room. And then when I went to check on them after the 20-minute mark, I would do 3 to 4 more strong stimulations, starting at the lateral edge and going into the Huatu Jiaji point. I have a question in my practice. Do I generally use 12 needles or less, or is this just for shingles? No, I would say that typical needle count for most patients is more in the low 20s. around 20 points. But that would be more of a chronic pain type patient or more of an internal medicine patient where we're seeing complicated patterns. What I'm giving you would be a very direct method for this case. Of course, you can include other points as needed. For example, if they have the feeling on their face, you might want to add LI20. You might want to add LI20 going to be tongue. You might want to add a stomach 2 point in conjunction with stomach 44 to help release the channel all the way up at the face level. If they have a headache that's associated with this, you might want to do a stomach 8 in combination with stomach 44. So utilizing a point that is in closer, more proximal to the location of the issue, and then using also a distal point to help to drain that channel is what I would recommend. So this isn't necessarily an exhaustive list of points that you could use. I would look at it more of a base unit, and then you could add as needed. For example, adding the Shenmen, ear Shenmen, and sympathetic points on the ear for those who are needle phobic. So that might be 4 additional points, for example, or say they also have some shoulder pain. You might, be adding an LI16 or a GB21 if they're like very stressed and they're holding their stress in their shoulders. You might be adding that GB21 as another point along the gallbladder channel. You may be palpating them and finding that there's some sore areas along the channel. You might want to include that as well. So of course, take into account your individual patient. I never recommend using a set protocol for every patient. Every patient is individual and different. And so really you want to adjust these points based on your individual patient and what they need and what their tongue and pulse are telling you. You may have folks who have a lot of irritability or who have other outstanding issues with, say, their liver, and going back to liver gallbladder. So you may want to add a liver 14 at the end of the liver channel if they have already, say, fatty liver syndrome, or if they are known to drink more alcohol, say, or say they're on lots of different medications or lots of different supplements. You may include the liver 13 or 14 as well on the liver channel. What are some other aspects? I mentioned the LI20. If they have more of kidney involvement, we'll get into that in just a second. But by all means, use your discretion in adding or removing points based on how your patients are presenting to you. Another question, in this protocol, do I treat supine first, then prone with electroacupuncture? When possible, I try to treat these cases prone. So in the points that are being blocked, like LI11, you can still get to it with their arms out. Prone, you just have to feel it for it. Sanjiao 5 could be a little bit more tricky, so you might have them positioned so that their arm, that their wrist is almost hanging off the table, or they may have their arms in front of them so that you can get to the Sanjiao 5 point. The stomach points can be a challenge when they're prone as well. But if you palpate and kind of get down and look down at them, you can still needle those points with them prone. Especially I like to have a little bolster to the feet, that the legs, they're prone. Total time I'm treating a patient. So typically I have a patient in the room for an hour, 50 minutes to an hour. And that includes about 10 minutes of intake and about 5 minutes of them getting off the coming to, and then 5 minutes be needling. The electroacupuncture would take a little bit longer to set up. But typically I have a room occupied with the patient for about an hour, with needle retention time being 40 minutes. I like to do the 40 minutes with the stimulation in between at the 20-minute mark. Because if you consider the chi cycling through the body every 20 minutes, then they're getting 2 rounds. I feel has been very effective for me. I know there's some folks who don't like to retain the needles as long, and that can be okay to properly dose people. And so it is important to set the expectation in the beginning of how often they should come in. And so for this case, I would recommend that a patient come in consecutive days. I know that this can sound to some practitioners like a pipe dream. I know there's some practitioners out there that feel like it's hard to get their patients in once a week. But if you explain to the patients that the results will be more effective more quickly if they come on consecutive days, or even every other day at the most in this type of situation, that they will get results very quickly, then they will be more accommodating to do that. So I need to take a break. You guys get a 10-minute break. I think this is a good time to do that. So Donna, if you want to come on or just break us, that would be great. All right, guys, well, you're welcome to take a 10-minute break. I think Donna was going to come on and say a few things possibly. But I will see you back here at 12:12.
Recording stopped.
All right, welcome back from the break. So with more practitioners implementing telemedicine and using more herbal medicine in their practice, there's a need for some pointers on modern uses, research, and applications. This is the start of something great for herbal medicine because it's the best way to help your patients remotely and earn an alternative form of income. So how comfortable are you with reading and interpreting lab results like blood tests, stool, and urine tests? I'm not sure if I was really taught that in school, and I for sure did not learn how to draw a parallel to what acupuncture points and herbs I should use. Luckily, we met a seasoned practitioner who specialized in both functional medicine and TCM. His name is Dr. Matt Van Benschkoten. He is also a speaker with many recorded videos on our platform. He designed the lab index in the clinical manual where you can interpret your patient's lab results into TCM diagnosis, and it'll also give you the herbal and acupuncture treatment. Let me give you an example. Let's say your patient's blood results came back with elevated creatinine levels. The diagnosis may be due to kidney damage or kidney stones, in which you can use Evergreen's collection formula, Kidney Detox, or Dissolve KS. Associated acupuncture points by Dr. Richard Tan, Master Dome points by Chuan-Min Wang, or Rickler points by Li Chong Huang will also be listed for your convenience. The clinical manual has been said to be the best guidebook of what herbal formula to use for specific disorders, what TCM and Master Dome points, auricular points, dietary and lifestyle recommendations, herb-drug interactions, lab results, and so much more. This book is a collaboration of the top TCM practitioners in our industries, including Drs. Richard Tan, Jimmy Chang, Chuan-Min Wang, Li Chong Huang, John Chen, Matt Van Benschkoten, and Cole Magbangwa, just to name a few. There is no need to reinvent the wheel. Most of the herbal formulas are put together by top herbalists like Jimmy Chang and John Chen's teachers. It's very difficult to go around with prescription if you follow the manual. We have been compiling this manual for more than 10 years, and it is the modern directory of Chinese medicine. It has everything you need to hold your hand through clinical practice, and the rest is up to you. I'll share the link and access information with you here in the chat room. If you have any specific questions, please feel free to email me directly at info@elotus.org. And everyone here also gets a free digital access, so no matter where you are, you can always access the clinical manual as long as you have internet access. It's also on your Blue Course access page, so be sure to save or bookmark the link so you will have forever access to it. We hope you will utilize this to start your journey on becoming a successful herbalist. This is the perfect opportunity if you are looking to start.
Recording stopped. Recording in progress.
All right, I think we are back here. All right, so everybody back. Seeing my screen here.
Yes.
Okay, great. All right. Oh, I know this is a lot of information. And I was just kind of reviewing through some of the questions. Before I get back started, I'd like to have everybody just kind of stand up and do a little bit of Qigong, keep our brain going for this next half. So if you guys want to start just doing some patting here at the Dantian. Let's bring that energy all around. Circle of digestion. All right, now let's bring that energy all throughout our bodies, up to our head, our kidneys, down our legs. All right, just a quick little, nice little burst of energy. All right, I was reviewing the questions, and I think I missed one. Somebody asked, let's see, where is it? Going back to the ophthalmologic emergency, herpes zosters. I had a question that they missed the connection of stroke or heart attack or increased cerebral vascular events. So the reason for this is because of the potential development for a uveitis or a keratinitis, that inflammation being so present and in close proximity to all of the blood vessels that go to the eye, which is very prominent. There's a lot of blood vessels that go to the eye. There's an increased risk of that inflammation going into the bloodstream and causing all different types of issues. So that could go to the brain, that could go to the heart. That's why the increased risk for cerebral vascular events. So I just wanted to address that question. You guys have great questions, so trying to keep up with them here, but if I missed yours, please just go ahead and say it again in case I missed the first time you said it. And then we will have a chance at the end to ask some questions too. So if you prefer to hold it to the end, that's also fine. All right. So going back to our treatment strategies, we talked about if lesions are not present and we are trying to clear toxic heat with spleen and stomach involvement. So now let's talk about if lesions are present. Still, we're going to use the same types of points that we described for clearing toxic heat with spleen stomach involvement. And again, we're going back to the electrostimulation and doing the surrounding technique for where the lesions are present and trying to get the inflammation to retreat back to the spine. All right, now moving on to kidney and urinary bladder involvement. If there's not lesions present, again, we can do the cupping, pricking to bleed the DO14, and then using cups at UB13, but adding cups for the kidney and urinary bladder at UB23 and UB27. Also then on the direct acupuncture side, using the same points that we used previously, the LI11, LI4, lung 10, lung 7, liver 3, threading to liver 2, Sanjiao 5, combined with gallbladder 41 and gallbladder 20, and then adding a kidney 2 and a kidney 10. Kidney 2 is great along with liver 3 at clearing toxic heat from the blood. So clearing blood heat, also just helping to release the heat from the whole body. And then adding kidney 10, the Hasi point, also to help cool the body down, bring more fluid into the body, help to nourish it a little bit. And then we can also add UB64 and UB62. The reason why, and this is to help address some of the symptoms that might be associated if they're having some urinary incontinence or urinary urgency, or I've seen a lot more cases recently where there's a lot of involvement with just a weird feeling in the bladder, almost like they have a UTI, but they get it tested and they don't have a UTI, and it seems to activate more of an interstitial cystitis. And so in that case, they just have this kind of burning or pain in the bladder area. And so these points can help with that as well, that feeling, the feeling like they need to urinate a lot. So I would do bilateral UB 64 and 62. You could use UB 60 as well, being using more of the source point. Sometimes I will add, if I am using UB 62, I'll also add SI3 to really help direct energy back to the spine. As you know, the SI3 UB 62 combination is good at treating a lot of different spine conditions, and also in eliminating some wind. So I would use those points in relation to each other, depending on what the patient's experiencing again. Why the order of kidney 2 to 10? So the kidney channel, being more of a channel of deficiency than excess, I would want to, so using kidney 2 actually does help to disperse the heat. So it is acting as a way to remove excess. And so even though I'm needling this along the channel line, I'm still able to, by using kidney 2 first, release the heat first, and then add to the nourishment of the kidney channel by going in the direction of the channel and utilizing kidney 10. If this individual already has a lot of yin deficiency, kidney yin deficiency specifically, then you may want to add kidney 6 as well. If this person tends to be more yang deficient, or they have trouble holding their urine, you may add a kidney 7 as well to help to lift the chi. I would not use the kidney 7 lightly in this case if there is a lot of heat, only if they're really severely yang deficient, if they have issues with prolapse. So if they have a uterine prolapse, or they have a prolapse of the bladder or the rectum, and a lot of incontinence, then I would use kidney 7. But in this case, I would make sure that I'm doing more stimulation on the channels that we're focusing on removing excess, and less stimulation, a lighter needling technique on that kidney 7 point. I would still use it just to help them with that prolapse and the incontinence, but again, just a lighter stimulation, just so that you're giving the body the input that you do want it to help to lift the yang, but not so strongly that you're going to have a yang rising attack and have this heat coming back up and flushing through the upper jiao. All right. All right, now if lesions are present and we want to clear toxic heat in the kidney and urinary bladder channels, with those being more prevalent in this case, again, utilizing those kidney points, kidney 2, kidney 10, utilizing those urinary bladder points of 64 and 62 or 60 if you choose, and then doing our electroacupuncture. Now, again, I'm just showing this picture of the back, but however, it may not be on the back, right? It might be on the chest. And in that case, you're going to want to have them side lying. So they're going to be lying on the non-affected side, and you can use a lead. Now, of course, if this is at the heart level, you're not going to want to use the electroacupuncture across the heart. But if it's below in the lower ribs area, then you can use the electroacupuncture, putting the positive lead at the lateral edge, which would be more proximal in the body. It would be more medial in the body actually, but lateral from the spine, and still utilizing that Huatu Jiaji point at the spine level. So it'd just be a different way of treating them, being side lying, or if it's on their face, you again might not want to use the electroacupuncture. You might want to just use heavy needling. That's what I would recommend, unless they're really not worried about having a bruise on their face. But you may elicit a bruise if you're using the electroacupuncture on someone who has the shingles appearing on the face. But you can still use this technique. You would just want to use a point in the face that is the most distal from the spine, which will likely be more medial in the face. And then use one of the cervical Huatu Jiaji points. And there should be some kind of lesion in the neck area that would accommodate. If not, then you can just follow the dermatome and relate the lesion on the face to the dermatome that is associated with the spinal nerve and use that Huatu Jiaji point. If it's on the again, you can use electrostimulation. They may need to disrobe more, but you still can use the technique of using the Asher point that is the most lateral from the spine and as the positive, and the Huatu Jiaji point in this case would be in the lumbar area, in the lumbar vertebrae, Huatu Jiaji points. Yes, so I have a question when the chest and back electrode, then the positive would be on the chest. Yes. Another question, do I find that dermatomes involved correlate or don't correlate with the patient's constitutional issues? Typically, yeah, we do find correlation with the patient's constitutional issues. For example, someone who tends to have more neck and upper back tension, they tend to have more of the presence up on the upper back or neck or face. If a person has more stomach issues or digestive issues, we see it more wrapping around the ribs to the chest, or more in that region of UB20, UB21, but not always. I mean, it's, you may not see the correlation right away. You may not, and it doesn't necessarily matter if you correlate that or not, because really you're treating what you see and what their feeling is. All right. So moving on here, if lesions are present, you can offer a topical treatment to help if they have a way to apply this. You know, if they have a partner that can help apply it, if it's on the back or if it's on the chest, they can do this. But to help prevent infection, if you are getting to them at the stage where they have these sores, they're ulcerated, they may be blistering, they may be trying to form more. In this case, I would recommend doing a topical treatment with grapefruit seed extract. Grapefruit seed extract is very powerful at killing a lot of different pathogens. Grapefruit seed extract is an antibacterial, it's an antiviral, it's the strongest antifungal that there is. And part of the complications and issues with herpes zoster can be infection occurring due to these sores becoming infected, being open wounds. And so to prevent further complications, we recommend doing a topical treatment. So if the sores are not, if the sores are open, okay, so if they're ulcerated, if they are oozing, then I would recommend doing 1 drop of grapefruit seed extract to 2 ounces of water, make a little mixture. You can dip a cotton ball or a cotton pad in that and apply it to the affected area. Try to do no less than 10 minutes at a time. So you may hold that cotton swab on there for 10 minutes, or you might dab it for 10 minutes and apply this 2 or 3 times a day. So BID or TID. If the wound is not open, if it's not at the stage of ulcerating, if it's just a red area, if it's just blistered but has not opened yet, then I recommend using a drop of grapefruit seed extract to 4 ounces of witch hazel. And the reason of the difference, the witch hazel will burn if the sore is open. And so that's not going to be very pleasant. And the witch hazel will penetrate a little bit better than the water if the sore is not open. So the witch hazel, I like to instruct the patients that they should find a witch hazel that is purely witch hazel, that does not have any other ingredients in it, such as alcohol. It's very common for witch hazel, or lower quality witch hazel, to have alcohol in it. And so I would recommend having a high quality witch hazel that doesn't have any other adulterants or other preservatives or ingredients. So 1 drop of grapefruit seed extract to 4 ounces of witch hazel. Apply that to the affected area again for at least 10 minutes, 2 to 3 times a day. All right. Now talking about some herbs. So our first formula that I recommend is going to be great at clearing toxic heat, purging fire, and it will help to drain damp heat. I said in the beginning that the differentiation between toxic heat and damp heat wasn't critical to differentiate between, because a lot of the treatment strategies and all of the acupuncture that I've mentioned to this point really is going to help whether it's toxic heat or damp heat. So don't be concerned that you're differentiating that distinctly, because really these treatment approaches will work either way. So our first formula here is an evergreen product. I love using this formula, Dermatrol HZ. I use this for a lot of issues even beyond shingles, but this is the evergreen formula that was designed to treat herpes zoster, hence the name Dermatrol HZ. So you can see the ingredients here. The Dao de Hu Gong helps to clear heat and eliminate toxins. We have Long Dan Sao, Jin Chin Sao. Those help to drain damp heat in the liver gallbladder. That acts as a diuretic, so it's clearing the damp heat through the urine. Then we have our 3 yellows combined with Zhurtsa. This is Huanglian Jedu Tong, Huang Qin, Huang Lian, Huang Bo, Huang Bai, and Zhurtsa. So these 4 ingredients, which make up Huanglian Jedu Tong, clear damp heat from all 3 jiaos. Those 4 ingredients are very effective at clearing fever. It's usually my first go-to if I have someone who just has a really high intractable fever. I'll have them start with that formula, which is a very simple formula. It's a very bitter formula that taken as a tea is going to be very difficult. It might elicit nausea and vomiting. And so I recommend using a pill formula if you're going to prescribe Huanglian Jedu Tong by itself. Moving on from those, we have Lian Chao and Jinyin Hua, along with Jing Jie. Those 3 ingredients also help to clear heat. They help to clear heat toxin. They also help to vent lesions and sores from the exterior. So this will help those sores that are developed, if they have developed at this point. It'll also help to vent if sores have not started to develop yet. So you can use this formula right away, even if the sores have not developed. Then we have Nubonza, Fugangyin, Zithua Diding, and Chong Lo. Those ingredients are going to help to clear heat. They're going to help to eliminate the toxic heat from the interior, and they also will treat the sores more from the inside out, helping to remove the heat and toxin at the internal and also going into the skin level. Then we have Shirt Shao. That's in the formula to help to circulate the blood and relieve the pain that's associated with the inflammation. That's going to help the formula to move through the blood to all the affected areas. Then we have Di Huang, Sheng Di Huang, and Mudan Pi. Those two will help to protect the yin from this heat, help to nourish the yin, but also to clear any deficient heat. So if they already tend to this yin deficient heat, these two herbs are going to help to protect the yin, help to clear that deficient heat that might be exacerbated by the toxic heat. And then, of course, we have Gansao. Gansao is going to harmonize the formula. So some cautions with this formula. It is very bitter and cold, right? We have all these ingredients that help to clear toxic heat, help to drain damp heat, help to purge the fire. So with all of these really cold herbs that are bitter, it can cause some nausea and vomiting if a patient is very spleen and stomach deficient. In those cases, I would still prescribe it, but I would recommend that they take this formula with food. So I wouldn't recommend that they take this on an empty stomach, but with some good nourishing spleen, some good spleen nourishing foods like a warm cooked soup or some rice or some yams or sweet potatoes. Also, this formula is not for long-term use, of course, right? We wouldn't use this long-term because it can be very damaging to the qi, to the yin, even though it has some protective ingredients. Long-term use is definitely not recommended. Question, a couple questions. Do I prefer the capsules versus the granules for treatment with the Dermatrol? I do, just for patient compliance. I love granules and I love tea. I have my formula here I'm drinking, but it's not going to work if the patient doesn't drink it. So I do like to use the Dermatrol HC capsules because this formula is so bitter. And it can cause vomiting. And so if they're drinking it and they're tasting it, they may vomit immediately. And you really don't want to elicit that response because then compliance, again, is going to go way down. Another question, I guess this was for the topical treatment. Can you use a spray bottle for this solution? You can, but again, you want to hold the solution on for 10 minutes. So a spray bottle wouldn't really, it would just drip right off. I would use something to apply it with and then hold that there, or even a washcloth to just apply it and leave it there for 10 minutes. For the patient who can't swallow pills, any suggestions? Okay, so making the tea will be bitter, right? So what you could do, I found a little bit of a hack on the very bitter tea. If you add tart cherry juice, the tart cherry helps to modify the bitter flavor enough that they can get it down. So that's something that I would recommend of making the tea and then adding just an ounce or two of tart cherry juice. You could also add a little bit of, sweetener, but I found that sweet doesn't really work well with the bitter flavor. It really doesn't help the bitter enough. So I would recommend some tart cherry juice and taking it with food. Another question, with the grapefruit seed extract, do you mean essential oil, or could you recommend the grapefruit seed extract product? Yes, so the grapefruit seed extract that I use, it's by Nutrabiotic. I can, let's see, how do I type? I can write that in here. Nutrabiotic. and they do wholesale accounts. Grapefruit seed extract is such a great product for so many things. I use it a lot for candida or for really intense fungal infections. Because again, antifungal medications are quite toxic to the body. And the grapefruit seed extract is very, very strong at killing fungus. And so it's been very effective in reducing fungal infections, including candida. Nutrabiotic, that company, they do have a pill formula. Grapefruit seed extract is also very, very, very bitter. It's very difficult to drink. And so I recommend they have some capsules. If you were going to do it internally, I would recommend getting the capsules. But there is a side note to that. With the grapefruit seed extract, it can literally disinfect a hospital. It kills everything. As a biomedical engineer, when I was testing, I was cultivating nerve cells and testing nerve cells for the biocompatibility of these brain implants. So I was growing these neurons, and we had to keep these neurons healthy in order to apply these substances that we were going to use to make sure that the implants were biocompatible. And so it was very important to keep our samples clean. And it was quite common that we would develop bacteria or fungus on these nerve cells because they had to be incubated at body temperature. And so we were trying to come up with a lot of different strategies to keep the Petri dishes clean. And so I decided at that point that we try grapefruit seed extract because that kills, everything. Well, I discovered that it also killed the nerve cells. So we weren't able to use that, but grapefruit seed extract will kill everything. So it's safe to use internally. Okay. It will not pass through and kill any of the necessary enteric cells, but it will kill all of the good bacteria. So if you are taking grapefruit seed extract internally, it's very, very, very important that after your round of grapefruit seed extract that you replenish the body's healthy bacteria with, I like to use foods. So with fermented foods, kimchi, kombucha, yogurts. I have a lot of people who don't do dairy, so maybe a cultured coconut yogurt or cashew yogurt. Of course, they can just take probiotics, but I try to shy away from using those as I feel that it's you're not certain what's actually in those products. So I like to use food itself. But again, very important if you are going to use grapefruit seed extract internally to replenish the good bacteria because it will kill everything. Let's see. Any thoughts on grapefruit seed extract compared to oregano oil or extract in terms of antibiotic properties? Sure, you can use oregano oil. I might use oregano with juniper berry and tea tree. That would cover all of your bases as far as antifungal, antiviral, antibacterial. However, I do find the grapefruit seed extract is just superior. It just works so well that I if they don't want to do grapefruit seed extract, then I'll prescribe the oregano, tea tree, juniper berry option. But the grapefruit seed extract is so superior at limiting fungal infections that I tend to go with that. Fungal infections are pretty prominent, especially if they do have more of a tendency to damp heat. So that's part of the reason I like to use the grapefruit seed extract. Let's see, any other questions I missed? I think I've got that chat. Yeah, toenail fungus. Yeah, the grapefruit seed extract works very well for toenail fungus. Here is the name of the company. I'll put it in the chat here. Nutrabiotic. I've been using them for, gosh, 25 years. We have a very good product. Yes, you can use the grapefruit seed extract internally for Candida. That's what I use. I'll use the capsules for that. And again, I will instruct the patient to replenish their good bacteria afterwards. Some patients will ask, well, can I do the probiotic or, while I'm taking the grapefruit seed extract? And you can, but it's going to be killing it. So it's kind of pointless. You can, if you want to, you can eat those fermented foods and everything while taking the grapefruit seed extract just to help. But typically it's just going to kill it as soon as it comes into your body anyway. So the best course is to do it after. And the typical course length to treat Candida, it depends on how strong the Candida is in the body. We're getting a little off topic, but this is, I know, an interesting topic that I think a lot of you are seeing in the clinic. We test for Candida in my office, and the test will tell us the level that's present. I use US Biotech. And so if they have a very strong presence of Candida, I'll do a month of a protocol. If it's at the medium range, then I'll do 2 to 3 weeks, depending. And the least amount of time I would do would be 2 weeks. So from between 2 weeks and 4 weeks internally with the grapefruit seed extract, 250 milligrams twice a day for Candida internally. And then you would want to test again after a few months because Candida does tend to like certain people. That could be a genetic thing. Or it could be just part of what their lifestyle is like. But I will instruct people to try to limit their sugar. And I mean, if they can completely eliminate it, that's best. So sugar, alcohol, also mushrooms, because mushrooms is a fungus. A lot of people think, oh, well, mushrooms is great for my immune system, and mushrooms are really popular right now. It's a fad kind of a thing. And we love mushrooms, in our medicine, we do. But mushrooms are definitely to be avoided if they do have a fungal infection like Candida, because Candida is a fungus. And so we don't want to put any more fungus in the body. So they should eliminate any kind of mushrooms that they're taking, sugar, alcohol, bread, anything with yeast in it. Beer is included in the alcohol, of course, but again, because of the yeast. All right, and with your questions, I'm kind of flipping back and forth between the chat and the question box. So I did type in that product in both now, so hopefully you can see that. Okay, but going back to our herbs here. So Dermatrol by Evergreen. I like a lot of the different Dermatrol products, but the herpes zoster product I've also used successfully for acne, especially when there's a lot of big welts, big infective type welts. It works quite well for acne. And I find that in teenagers, this formula works really well for that because they have a lot of fire anyway. And so this could be a good first response for acne as well. So that is another great use for that product. Kind of off-label, if you will. And the other product that I use for shingles or herpes zoster is a formula Puji Xiaodu Yin. This also works very well. I would say this one is a little bit more acceptable if they have damp heat as more of the differential diagnosis than the toxic heat. Again, both of these will treat, you could really pick either, but if you want to be best in your differentiation, then I would go with the Dermatrol HC if there's more toxic heat, and Puji Xiaodu Yin if there's more dampness associated. And you can see here in the ingredients, the first two ingredients being Huangqin and Huanglian, so very strong at clearing heat. And then we have Chen Pi, which is just going to help to move the qi, help to get that, that dampness to be removed and moved. We have Gansao here in a stronger dose. And so it's not just harmonizing the formula, but in this case, it is acting as a steroid as well. So hopefully most of you know that, that Gansao or licorice root does have a steroidal effect. It can be very, very useful in a lot of acute reaction situations. So I have a lot of patients who come in with acute dermatitis from an allergic reaction. We could have hives or swelling. The hives could go into the eyes. I've experienced this myself. I'll use a very strong dose of Gansao to help control the swelling immediately. So I'll have patients that'll come in, I'll mix them up a little tea of at least 9 grams of Gansao. And then we'll include other herbs depending on what they're presenting with. For example, for skin type reactions or hives, I would recommend using Song Erza, Xiao Wu Tang or Yi Jiao Tang. We could use Boha, we could use He Wu, Chuan Lianzi. These all help to direct the skin, Chuan Shen, Jigen, along with what I would call a triple dose of Gansao. So a normal harmonizing dose of Gansao is 3 grams. And so I would increase this up to 9 grams if we do have an acute reaction. All right, so then we have Xuanshen. Xuanshen is a great antiviral herb. It's great at clearing heat, especially in the upper jiao. We have Chai Hu that also helps to vent rashes. Xuanshen enters the lung channel, so it's also great at any kind of skin issues. Chai Hu is going to help to lift this formula up. Typically, our issues are going to be in the more middle or upper jiao. We have Zhegang. Zhegang is going to help to clear at the skin level any of that dampness that's occurring. Then we have Lian Chao, Banlangan, Mabo. Those are all great for antibacterial and antiviral properties. So those are going to help to calm the virus down, clear the heat. Of course, Nubangsa, Boha. This is going to help to, again, vent externally, along with Jiang Sun. That's also going to help to vent the rash, and Shengma. Shengma also is great at venting rashes. So this, again, Puji Shaodian, great formula for a lot of different skin type issues, acute skin reactions, but also very effective in clearing the damp heat from the skin, from internally, and using those ingredients that also help to vent at the skin level is very useful. This formula, again, is very bitter. It's also quite acrid in dispersing. And so we do want to use this in caution with those who have yin deficiency. We don't want to disperse too much of their yin, or too much, if they're very qi deficient, too much of their qi. So we do want to be cautious. Again, I would still use this formula, but I would be watching out to support their yin. I would be recommending herbs that would help to nourish their yin, and foods. So we might do a modification of Puji Shaodian and add a Di Huang or a Mudan Pi, or both of those 2 herbs to help to protect the yin in those cases. Or you could recommend they have some yin nourishing foods like coconut in any form, pears. We'll talk about food here in just a second. Bone broth. So we want to really make sure that yin is being supplemented in the process. And then also, of course, this one's not for long-term use either. This is for the first phase that we're treating, which is to clear the damp heat or the toxic heat. Now moving on to some nutritional recommendations for the toxic heat and damp heat. So right away, you want to have them avoid the spicy food, right? Spicy food is not going to help them right now. They already have too much heat. We don't want to inject more heat. Also alcohol. Alcohol is going to create more damp heat, more toxic heat in the body. It's also going to compromise the liver function. And we really want that liver to help us to clear the viral load that exists from herpes zoster. Also dairy is going to promote that dampness. It's going to also potentially block the elimination of our toxic heat. Greasy fried food, same with the dairy. We don't want to create more stickiness for the body to hold on to this heat, to hold on to this dampness. Also, I tell people to avoid buckwheat and shellfish. Buckwheat and shellfish can promote more wind to get into the channels. And we're already seeing this flux between internal and external. And so we don't want to have them eating buckwheat or shellfish to promote more wind coming in through the exterior while we're trying to vent the exterior. Also processed foods and preservatives, we just want to keep their diet clean, again, so that there's more ease at eliminating the toxic heat and the damp heat. Sugar, yeah, I have in the comments sugar. Yeah, sugar, of course, too. Good to avoid sugar also. Most definitely. Okay, and then consume more. I don't like to tell people just to avoid things. I like to give them things that they can eat, so that they have an idea, not just, I'm restricting them, but that I'm also giving them some healthy options. So consume more. Mung beans and adzuki beans. Mung beans and adzuki beans both are very good at removing toxic heat, at eliminating toxins in the body while nourishing the patient. So this is especially a good choice if they have qi and yin deficiency, because it is helping to nourish the qi and yin while removing toxic heat. I love using mung beans, especially adzuki beans are a little harder to work with, in my opinion, just because of that sweet flavor, that sweetness. It's harder to make good, hearty, savory foods. So I like to use mung beans a lot. And typically you're going to find it sprouts, or I'm sure you can find them in Whole Foods. So you'll want to soak those beans overnight, or do a quick boil before cooking them, of course. Also dandelion greens, asparagus, bok choy, really all the dark leafy greens except for kale. So I would tell patients in this case not to have kale. Kale is actually a warming dark leafy green, so you want to try to avoid that one. But asparagus is great for clearing heat, clearing toxic heat, clearing deficient heat while nourishing the yin. Dandelion greens, of course, great at clearing toxic heat. Bok choy is a lot like asparagus in that it will help to clear that toxic heat and deficient heat while nourishing the yin. Watermelon, or any type of melon, is going to be great at clearing the damp heat, the toxic heat. And now is the season for melons, right? So for our summer heat, down here in Tucson, we have monsoon season. And so it's not just hot, but we get this damp heat towards the end of the day. And so melon is great at just mitigating that damp heat or toxic heat. So melon's also a great one for herpes zoster. Pears, especially the Asian pears if possible. Pears are great for nourishing the yin and clearing heat, and especially in the skin and in the lungs. And so pears is another good recommendation. And then coconut in any form. Coconut water, of course, being the same pH balance as blood, it goes into the system very quickly, very good for yin deficiency, very good for protecting the yin and cooling the body. But I say coconut in any form that they want to consume it in. So coconut water, coconut milk, coconut flakes, coconut oil, coconut, however they want to consume it. I have questions. Spinach, Yeah, sure. Spinach is also good. Any of the dark leafy greens, really, except for kale, would be fine. And spinach is okay, but really the asparagus, bok choy. I like to also recommend Swiss chard, collard greens. Those can be a little bit more effective, but spinach is great too. How to eat dandelion. So I would just eat it. Just put it on a salad, put it in with your soup. You could put it in with your rice or with other vegetables. If you can saute with it. Really, there's lots of different options of how to consume dandelion, but really just getting them to eat it is in any way they want. All right. Our second stage here is going to be to harmonize the Xiaoyang. So as I mentioned in the beginning, we may need to skip over the step to go directly to the constitutional imbalances or the imbalances that have occurred due to the toxic heat or the damp heat, and or from strongly removing that very quickly. And so I say second is a weak second. I've had probably a 50-50 in cases of going straight to harmonizing Xiaoyang or going to a constitutional balance first and then going back to harmonizing the Xiaoyang when I feel that their body is ready and accepting to harmonize the Xiaoyang. Because we are still trying to purge the body of this pathogen while harmonizing the liver and spleen together, the clearing and venting the exterior. If someone is very qi deficient and you're trying to harmonize the Xiaoyang, they may have more exterior symptoms. This is also the reason to go to that first phase first of clearing the toxic heat and damp heat, because if you go straight to harmonizing the Xiaoyang, you have the potential to then create more exterior symptoms. And so you do want to make sure that the toxic heat or damp heat is cleared before you get to the stage, and that the body is strong enough to handle it. So when we are ready to harmonize the Xiaoyang, we can include our points that we had before of Sanjiao 5 and GB 41, combining that with GB 34 and 20, again, to just keep that Xiaoyang layer clean. We want to make sure that we are venting any residual heat that might be holding on. Also including Li4 liver 3, using that as a 4 gates type function of moving the qi, keeping the qi from getting stagnant again. And then using that liver 3 in combination with liver 13 is very useful in harmonizing the Xiaoyang and also the communication between the liver and the spleen channels. Liver 13 is great for helping to harmonize those two organ systems. Also, we want to make sure we are releasing any exterior that still needs to be released. So we want to use lung 7 and Li11 together. Those as luo connecting points can help to make sure that any kind of residual that needs to be vented is vented. And then I would just also include a spleen 6, stomach 36 to help supplement the qi while you're harmonizing the Xiaoyang. So really thinking about, in harmonizing Xiaoyang, thinking about harmonizing the connection between liver and spleen, helping to regulate the flow of qi and blood in the body, and also supplementing the qi and blood. And this is in a minor form. And that's why I say go back to the third step, which is treating constitution if there is a severe qi or yin deficiency, because really in the harmonizing Xiaoyang stage, we're really just doing it to supplement, to just help the qi to remain intact while we are venting, releasing, and harmonizing. And then, of course, the main formula that we use to harmonize Xiaoyang, straight from Zhang Hanlun, is Xiao Chai Hu Tang. This is a great formula. I use a lot in my practice for harmonizing and the cases of a lot of different types of viruses, going dormant and rearing its ugly head later on in life. Here in Arizona, we have valley fever is pretty strong, and especially animals have a lot of incidence and prevalence in Arizona. And so I will prescribe this formula for both humans and animals, dogs, more likely than any other animal who contract valley fever. It's an excellent formula to keep the titers down in the cases of valley fever. Of course, this might not be the only formula used in the case of valley fever. You may need to combine it with something that will help open the lungs if they have a severe cough, or to prevent any lung fibroses. And so you might combine it with a qingqi, or you might use an evergreen product like ENT, herbal ENT, or resveratrol deficient is another good one to help with the lungs. But Xiao Chai Hutang, great formula for harmonizing the Xiaoyang in this situation as well. So we have Chai Hu and Huang Qin. Both of those ingredients help to harmonize the Xiaoyang specifically. They both enter the liver and gallbladder together and help to eliminate any residual virus with the Huang Qin. Ban Sha also is great to help break up any phlegm, any dampness that might be hanging on, because we really want to help eliminate anything like sticky in the body that's holding on to these viral components. I talked in the very beginning about this immunoglobulin Nectin-1. So Ban Sha can be useful in helping to eliminate the body, or eliminate the Nectin-1 prevalence in the body, help to break up that stickiness that it's aggravating. Then we have Dong Shen. This is to help protect the qi and yin. You can use Ren Shen as well, or Xiyang Shen. Dong Shen is typically what we see in the Chao Chai Hutang formulas. It's just a little safer to use, but Ren Shen can be a lot stronger. You just want to be careful in those who have hypertension that's uncontrolled, or uncontrolled high blood pressure. You wouldn't want to use it in those cases. And then we have our three sweets: Shengjiang, Datsao, Gansao. These three are there to both harmonize the formula and harmonize, again, the Xiaoyang, really to bring harmony to the body, to the spleen, stomach. This formula, again, is not for long-term use because it is ascending. If you were to use it with patients who have a condition of excess above and deficiency below, it could cause headache, dizziness. It could cause reckless blood, like nosebleeds or bleeding from the gums. So you do want to be cautious in that case where they have excess above and deficiency below. In that case, you may want to start with treating that before going to harmonizing the Xiaoyang. And I have a slide for that at the very end of what to use to treat that condition. I would use Tian Wang Bushen Dan in that case first, to help to clear the excess above and deficiency below, help to nourish the kidney, qi and heart yin, calm shen, before using this harmonizing Xiaoyang approach. Okay, another question, aloe vera. I assume you're meaning to use aloe vera as a topical. You absolutely could use the aloe vera. You could even mix the grapefruit seed extract with aloe vera and apply it that way. Aloe vera is great for clearing heat on the skin surface and helping to prevent infection. I would want to use a potent form of aloe vera, meaning straight from the aloe plant. So if that's something that you can grow and cut and open and use directly, that's the best. I know there's a lot of aloe vera on the market that is adulterated and has a lot of other products in it that you would not want to put on an open sore. So I would just be careful on what type of aloe vera you're using. And again, it being the best would be to use aloe vera that you cut yourself from the plant. All right. Moving along to treating constitutional imbalances. So in many of these cases, they're going to have a spleen and lung qi deficiency. That's part of this Wei qi defense that will cause them to contract these things in the first place, to contract exterior conditions, to have their exterior be weak enough that it's presenting at an exterior level. And so we want to treat that imbalance either as the last phase of our treatment approach or prior to harmonizing the Shaoyang. And so here we're going to use acupuncture points spleen 3 and spleen 6 to help really tonify the spleen qi. We can use Ren 6, Ren 12, and Ren 17 to help to, again, tonify the qi very strongly in the body. You can combine those with stomach 25 and stomach 36. So again, there's this 4 doors, add stomach 36 and Ren 17 to help to really supplement the qi. We want to use Li4 and liver 3, again, to move the qi, because we don't want to nourish the qi so much that it's getting stuck. And so we want to move the qi a little bit. This Li4, liver 3, I would not do bilaterally. I would do contralateral sides. So I would do Li4 on one hand and then liver 3 on the opposite side of the foot. And that way the qi will be circulating through the body. I find that that's enough in these cases. You don't want to move qi too strongly when you're trying to nourish it, because you'll be just defeating your cause. And then we have lung 3 and lung 9, which strongly supplement the lung qi. Lung 3 is great for after illness, or to help prevent illness, to help really strongly nourish that lung qi. And then lung 9, also helping with movement of the blood and the vessels, is another good reason to use this point, but it also is strongly nourishing for the lung channel. Moxa. So as long as all of our heat is cleared and we're not in any danger of having any more sores, at this point, I would recommend using some moxa at stomach 36 and spleen 6. However you want to do the moxa, if it's a moxa stick or a moxa cone, or you could also do a moxa box at Ren 8. But I like doing stomach 36 and spleen 6. I'll frequently do this on myself just to keep my qi up in treating some of these patients who are sick. For nutritional recommendations, again, avoiding greasy and fried food. Sugar should be on there too. Somebody pointed that out. Sugar, definitely avoid. Dairy and spicy food. Consume more pears. Again, the pears are great at nourishing the lung qi and yin, also helping the skin itself. Yams and sweet potatoes, very strong spleen qi nourishing foods. You'd want to recommend some bone broth. Best bone broth would be a beef bone marrow bone broth, or if they're opposed to the beef bone marrow, you could do pork or chicken. So a good strong bone broth. I like to instruct patients to make their own. I'll instruct them to use a crock pot and cook the broth with the bones I like to do for 36 hours at least, up to 3 days. So I will typically for myself do a 72-hour broth. And really the key is keeping it in that crock pot, adding some more water as needed, so that the water doesn't run out. If you do put it on the stove and you're just using a crock on the stove, that's difficult to keep the water going, and you run risk of burning the broth and burning the bones. That is not a fun situation. It's very stinky. And then also some just soups. So you could use the bone broth for the soups. A chicken and rice soup is great for spleen and lung qi deficiency. I would use a basmati rice. Basmati rice also just by itself is great for tonifying the spleen and lung qi. Also, it helps to drain any dampness that might be present. So basmati rice being great for this type of condition. What is basmati rice? So it's just a type of rice. You find it in a lot of like Indian cuisine. It has kind of an aromatic quality to it. And so because of that, it's good at dispersing and any kind of phlegm and dampness. But it is also useful for nourishing the qi and yin. All right. So some formulas that you can use to treat spleen and lung qi deficiency. Bujang Yijitang, great formula, very tonifying, very lifting of the qi. So people who do have prolapse, who do have urinary incontinence, people who are just so fatigued, or who have a deficiency headache, Bujang Yijitang is really great for them. If there is any amount of stagnation in the body, I would use caution against using this formula. It can cause some aggravation or irritation, irritability if used on someone who is not as deficient as you thought and has more stagnation than you thought. That stagnation will get worse and they will become very irritable. And so make sure you're using this patient only on pretty severely qi deficient patients. This formula containing Huang Qi, that's going to lift the qi, and Ren Shen. Again, you want, with these two ingredients, you want to be cautious if they do have uncontrolled hypertension or uncontrolled high blood pressure, because it can cause the blood pressure to rise. So you do want to be careful in those cases. You may just pick a different formula like the Lejun Satang in those cases. So this formula also contains Baizhu. Baizhu is also great at nourishing the qi. It also can have the effect of breaking up some dampness. Your Gansao, of course, helping to harmonize the formula. Then we have Dangui, which does move the qi a little bit, nourishes the blood. Our Chen Pi, again, breaking up some of the dampness and moving the qi a little bit. We have Sheng Ma, that's bringing the formula up, lifting the qi, lifting the yang. And Chai Hu, same, helps to lift the qi, does help to soothe the liver qi. But again, I find that if there's too much qi stagnation, these ingredients, the Dangui, Chen Pi, Chai Hu, are not strong enough. If you are mixing this formula yourself, you can add, increase the doses of those ingredients to help with the qi stagnation if you are concerned about that. Or you could just omit the Sheng Ma. That would also be helpful if they do have some qi stagnation and you're worried about that. But it is very useful at lifting the qi, especially in prolapse cases. Oh, sorry. Let's go back here. Somehow I went ahead. Okay. Also with Bujang Yijitang, you want to be cautious. It is contraindicated with yin deficient heat because it can cause more uplifting of this heat and cause like a yang rising effect. So you do want to be careful with yin deficient heat. Another formula you could use Lejun Satang or Sijun Satang. I like using Lejun Satang over Sijun Satang because it has more effect of clearing the dampness. And I find in these cases, if they are spleen and lung qi deficient, that they likely are going to have some damp quality to them. So with Lejun Satang, we have Ren Shen or Dang Shen. And again, You want to look at your formula. If you have someone who with high blood pressure, hypertension that's uncontrolled, you would not want to use the Ren Shen in these cases. You would want to use the Dong Shen. Baizhu, once again, to help with nourishing the qi, has a mild effect of breaking up dampness. Our Fuling, Chen Pi, Ban Sha, those 3 ingredients are going to very strongly help to drain dampness and break up phlegm. And then we have our 3 sweets again, are harmonizing, helping to nourish the spleen qi and digestion, and harmonizing the formula are Shengjiang, Dat Sao, and Shirgan Sao. Again, we want to be cautious with the indeficient heat. Again, it's can be too draining. So if they are yin deficient, you really don't want to drain too much dampness, because then you're draining the yin as well. So just be careful in those cases. All right, moving on to the imbalance being liver qi stagnation. So here, if we had someone who is very stressed, who does have a lot of stagnation, and this was one of the contributing factors to them developing this heat in the first place, we want to address that so that they have less likely of a reoccurrence of the herpes zoster coming about. So we want to include points like Li4 liver 3. In this case, if they do have a lot of qi stagnation, I may do bilateral now. Again, when I can, I like to let one hand be free, mainly so they can itch their nose or do something that they need to do, answer the phone, which is unfortunately kind of common in the treatment room, or use that call button. But if they do have a lot of qi stagnation, if the tongue is a very dark purple or even brown color, then I will do bilateral on the Li4 liver 3. And then also liver 13 to help to soothe the liver qi and help to soothe the connection between the liver and the spleen. Spleen 6 and stomach 36, again, to help nourish the qi. If it's been stagnated very long, it's likely going to be deficient as well. Then I also like to use some points on the gallbladder channel to really help move the qi through that system, which would be gallbladder 41, 34, and 20. These points are going to be very useful also if they have qi stagnation headaches, if they have a lot of temporal lobe headaches or discomfort, or if they have some TMJ associated with stress. You can use these points and then also add a GB2 or a GB1 or a Taiyang. Taiyang I would use in this case just to help calm the mind, along with Anmian here behind the ear, very close to GB20. And if you wanted to choose between GB20 and Anmian, you could. I like to use them both. This really helps to strongly release the brain, release the mind, helps to reduce the stress, especially if they tend to ruminate about things, or if they have some unresolved conflicts. For example, these combination of gallbladder points with Anmian and Taiyang are really useful at just releasing that from their mind. Also, I like to then use ear shen men and sympathetic on the ear. Again, these just help to calm the person down. These people who tend to be overly stagnated do tend towards this heat realm. And so they might be irritated, they might be more irritable on the table even. And so using these points to just help calm them down right away can be very useful. Also, we can then do some cupping. For liver qi stagnation, you may want to do moving cups to activate some of that gua sha response and also just to get the qi moving. So I would do a moving cup from UB20 up to UB15, making sure to really concentrate on the areas of UB20, UB18, UB15 to help to soothe the liver, help to reinforce the calmness using UB15 and helping to calm the shen. And then nutritionally, again, we're going to avoid greasy fried food, dairy, sugar, processed food, preservatives, and over-the-counter vitamins. I see a lot of patients that are also maybe seeing a naturopath, or even my local chiropractor here prescribes a lot of over-the-counter supplements. I see it a lot, and the patients think they're really, just in doing really a lot of great things for their health by taking literally a whole desk full of vitamins. I've seen people with like 20 different supplements. And this can be really hard on the liver and really create a lot of liver qi stagnation, not just because of just the vitamin overload and the liver having to process that, but also because of the other ingredients that they put in vitamins a lot of times. So I will have patients bring in all of their vitamins for me to look at. I like to actually have them bring in the bottles themselves, instead of just telling me like, oh yeah, I take a C, I take an E, I take a vitamin D3. I want to actually see everything they're taking in the bottle. And the reason for that is because formulas change quite often. And so even if they tell me the brand name, I don't necessarily know what is in the bottle they got. So I'm going to look at the label and I want to compare them to make sure. I have so many patients that are over consuming zinc, over consuming vitamin E, over consuming vitamin A and D, and some of these that are fat soluble, like A and E and D, and that can be really toxic to the liver. And so taking a look at all of their supplements all together, a lot of times, more often than not, when I have patients do this, they are really over consuming these vitamins. And I'm especially concerned about those fat soluble vitamins. And then zinc also, for some reason, I know zinc is great. It helps to stop the replication of viral replication. So it can be useful, absolutely. And I do recommend zinc to people all the time. But for some reason, these companies are creating these zinc capsules with a lot of zinc, with 50 milligrams. I'm seeing this more and more. That is a lot of zinc. That can be really quite harmful to the body. Really, the recommended dose is no more than 11 grams for adults per day. And so I will take a look at people's zinc as well and try to get them on a supplement that's 10 milligram zinc product, which is more beneficial and still has the function of stopping the viral replication. But also with vitamins, there are ingredients like polyethylene glycol, PEG or PEG. This is a petroleum product that is a known carcinogen. And most people aren't aware of this. They're not even thinking about this in their vitamins. But I do try to get people off of the polyethylene glycol. This is something that's been associated with not just cancer, but a lot of autoimmune disorders, thyroid disorders. And really, we just need to eliminate as much petroleum in our bodies as possible, because petroleum is not easily removed from the body. Once petroleum is present in the body, it just accumulates, and it is very, very difficult for your body to eliminate that. So I'll be looking for polyethylene glycol. I'll also be looking for polysorbate 80. This is another very common preservative that will be put in supplements, and it is also another known carcinogen. So I'll be looking for those ingredients and making sure that none of their vitamins have that. Also, if the vitamins are overlapping each other. But really, in general, for this case, if they have liver qi stagnation, I tell them to stop all vitamins, at least until we get their liver qi soothed. And of course, we don't want to stop them forever, and some supplements are great. But at least for the time being, I will have them stop all of their over-the-counter vitamins, just to give the liver a little bit of a break, so that we can soothe the liver qi and get the liver functioning better, and then they can resume. And then consume more. So our dark leafy greens, once again, great for our liver, anything green really, right? And then our citrus fruits, great at helping to move qi. I'll also instruct patients to make a citrus peel tea along with mint, and they can use fresh peel and eat the fruit, and that's really good at helping to move their qi. So tangerines being one of the better citrus fruits. So I'll recommend that they take a tangerine, eat the tangerine, and then use the peels in a tea with some mint. I'm gonna check over here at your questions. Great, yeah, people are recommending standard process. Again, check the labels. Standard process is a good choice, but not all. I have found some standard process products that I don't, that aren't always as pure. As they say, peels only if organic. Yes, absolutely. And part of my nutritional recommendations to all of my patients are to eat as organic as they possibly can. If you're not going to be using the peel, then the thicker peeled produce are a little safer to not have organic. But if you are using the peel, absolutely you want to use organic. All right. Okay. So some formulas for liver qi stagnation. So we have a couple of formulas here. Chaihu Shugan-san. This is a great formula, of course, for just soothing the liver qi, moving the liver qi. It's also great for pain control and also for digestive issues arising from qi stagnation. So we have Chen Pi that will help to move the qi and help to break up dampness or phlegm. Chai Hu, which helps to soothe the qi, the liver qi specifically. Chuan Chang, which goes to the liver and gallbladder channels and helps to move the blood. We always, whenever we're moving qi, we want to move the blood also. Zhe Ke, or Zhe Shao, or you could use Zhe Shi, but this also good moving the qi and breaks up phlegm and dampness. Then we have Bai Shao. As you probably know, Bai Shao is also great at soothing the qi. It's also great in combination with Ganzhao at helping to relax muscle tissue. So people who are very qi stagnated, they tend to be real tense. And so the Bai Shao, Zhi Ganzhao combination is great at helping to relieve the muscle tension. Also Shang Fu, another great herb to help with liver qi stagnation, enters the liver and gallbladder as well. And then another formula you could use is Xiaoyao Wan. So Xiaoyao Wan is great if they have qi stagnation with spleen deficiency, blood deficiency. So it's a little bit more all-encompassing if there are comorbid patterns of the liver and spleen not communicating well together, the liver overacting on the spleen qi being deficient. So we have our Chai Hu again to soothe the liver qi. We have Dang Gui to help nourish the blood and move the blood. Bai Shao, again with Zhi Ganzhao, is going to help to relax the muscle tissue, good for managing pain and also to help nourish the blood. Bai Zhu, again helping to nourish the qi and drain any dampness mildly. And then Fu Ling to help with draining dampness. If we have someone who has more kidney qi and kidney yin deficiency, we may need to address that. We may need to address this before harmonizing the Xiaoyang. As those who are more deficient in qi and yin, these might be our older population patients, and they may not tolerate too much draining and purging all at once. So you might need to break this up and do that first step, and then come to this step and then go back to harmonizing the Xiaoyang. And so in this case, we're going to want to use some kidney points, kidney 3 and kidney 6 to nourish the kidney qi and yin and then combined with lung 7, just to help really nourish that Ren channel. Spleen 6 and 10 to help, again, nourish qi, yin, and blood. We can use stomach 36 to help with nourishing qi and blood. And then you can also add stomach 42, especially if they have that crack in the center at the in the stomach area. If they have some stomach yin deficiency, I would add the stomach 42. Also a great point. If they have any stomach yin deficiency, they're not going to be processing their food well. They're not going to be digesting well. And so we really want to supplement that so that we can supplement the kidney, qi, and yin. And then liver, Li4 and liver 3, just to keep that qi and yin moving. Also, liver 3 is great for nourishing the liver yin. Nutritionally, we want to, again, they should avoid, the spicy food. They should avoid the processed food, everything we've already talked about as far as sugar and dairy and spicy food, but they should consume more bone broth, especially if they have an essence deficiency as well, or if they're worried about the aging process. Bone broth is great at helping to replenish. Pork and chicken, great for nourishing the yin. Also just encouraging warm cooked meals, black beans, kidney beans, both great for nourishing the kidney channel. Any kind of nuts and seeds. Nuts and seeds help to nourish our nuts and seeds, and the kidney being in charge of those, of our seeds. It's important to replenish the kidney with some nuts and seeds. Also, coconut, we talked about in any form, and berries specifically are great for nourishing the yin. And a formula to help supplement the kidney, qi, and yin. I love Imperial Tonic by Evergreen. It is a great all-around tonic. But again, we wouldn't want to use this in the active stage of infection, because it could nourish that as well. So we do want to be mindful of when we are using this, that the person does not have any excess symptoms currently. So Imperial Tonic, I like to use this with some of my older patients, or some of my women who are going through menopause or who are perimenopausal. But also just a great formula for replenishing after illness, replenishing the qi and yin. So we have this great formula to nourish yin, yang, qi, and blood. And it starts with Huang Qi and Shi Yang Shen. They both strongly nourish the Yuan Qi or source Qi. They're also tonifying of the immune system. And so because of this, we do want to be careful with any of those people who are on immune suppressants or who have an autoimmune disease. We want to be careful not to activate that system in these patients. Also, then we have Baizhu and Fuling, which help to tonify the qi, aid in digestion, help to replenish the qi in the body after the harsh, damp heat and toxic heat draining herbs. Also, then we have Shu, Di, Huang, Dongui, Baishao, and Chuanchang. So this formula, this is a formula, right? Siwu Tong to help to nourish and keep the blood moving. So those 4 ingredients, great at nourishing the blood, replenishing the blood after illness. Also Shan Yao, tonifying the spleen, the lung, the kidneys, very important in nourishing not just the qi, but the yin. Guixin will strongly tonify the kidney yang. A lot of times if we don't think about the yang, we're not going to really be able to nourish the yin. I've experienced this myself where I've been really focused on nourishing the yin because the patient has such severe signs of yin deficiency. And if I don't consider the yang aspect of it, the yin tonics just don't take. So it is important to nourish the yang and the yin a lot of times together. If they are really severely yin deficient, they will need a little bit of supplement of the yang as well. And then we have Wu Weizhe, which helps to astringe, helps to prevent leakage of essence, helps to retain the essence. Great ingredient in this formula. And then again, our 3 sweets, Shengjiang, Datsao, Zhigansao, to harmonize the formula. Again, I had mentioned be cautious in those with autoimmune or any of those people who are on immune suppressants. Also, anybody who's on an anticoagulant program or antiplatelet drugs, you do want to be careful due to the moving nature of this formula. This will nourish the blood and move the blood. So those that are on antiplatelets, we don't want to nourish the blood too much. Those that are on anticoagulants, we don't want to move the blood too much because that could alter their treatment with those drugs. It could also cause more bleeding. So we want to be careful there. Also, don't, as I had mentioned, don't use during an acute infection or during an excess. Okay, good. Yeah, somebody put in the chat room, who do I use for my Candida testing? I use US Biotech, that's correct. They also have a really great food sensitivity test that I like to use to test immunoglobulin G presence. There's some controversy over using food sensitivity and immunoglobulin G type reactions, but I've had a lot of great success with it. There's so many food sensitivities nowadays with the quality of our food, or I should say the lack of quality of our food, the genetic engineering that's going on, the pesticides, the herbicides. Our body is not recognizing food like it used to. It's seeing it as a pathogen. And so it's attacking our food. And so many people have so many issues because, and Qi deficiency being one of them, because they're not getting the proper nutrition from their food, their body is attacking the food. And therefore, I've found it's really helpful to have my patients do a food sensitivity test to see what foods their body is reacting to, so they can eliminate those foods to eliminate the inflammatory reaction that the immunoglobulin G response is activating. And by eliminating those foods for 3 to 6 months and doing a whole balance of their body system and focusing on the digestion, we can eliminate those food sensitivities. They can start to slowly integrate those foods again without having the inflammatory reaction. And US Biotech does have a great product for testing. I have a question. If a patient has Hashimoto thyroiditis but is in remission, can she still use Imperial Tonic for her energy boost? Yes and no. So if the thyroid levels are closely monitored and they seem to be in balance, then you could use this formula. I would start with a very low dose. So typically I'll recommend 3 to 4 pills 3 times a day. But with this patient, I would recommend 2 pills twice a day, just to see how they do with it. Typically, these people are going to be very sensitive to medication. And so I would give them a very small dose to start. However, to be a little bit more cautious, this wouldn't necessarily be the first formula that I would go to. So I might go more to a Lejunzitang to eliminate the Huang Qi and Shi Yang Shen. I would go with the Dang Shen and Baizhu combination instead of the Huang Qi and Shi Yang Shen or Ren Shen. All right. All right, moving along. So a more complicated syndrome that you might see would be a kidney qi and heart yin deficiency. This does tend to be in our more older patients as well. And so here I would just add a few points. I would add kidney 2 because now we have a little bit more propensity towards empty heat. And so I would use kidney 2 to help clear that kidney, that yin deficient heat. Also, I would add heart 4 and heart 7 to help nourish the heart yin. And then definitely including Ren 4 for the kidney and Ren 17 for the heart. And you can see our nutritional recommendations are fairly similar. I would add the adzuki beans. Sorry, misspelling there. Adzuki beans and the kidney beans. The adzuki being red, that will go to the heart. And then you could also add some cherries and strawberries and goji berries, and that would help with these patients. With these patients, there's a lot of times we'll see a little bit of dampness. This is one of our heat above and cold below, could be part of the manifestation, could be part of the excess that they're seeing, heat rising, or they might have a little bit of dampness that gets stuck in the upper jiao. So I love the formula for these patients, Tian Wang Bu Shin Dan. This is also just a great overall formula for anyone who has reoccurrent illness or who is more immune compromised. You could use this formula. So we have in this formula Sheng Di Huang, Ren Shen, Tian Mendong, Mai Mendong, those 4 ingredients being strongly nourishing to the yin. Also Tian Mendong and Mai Mendong and Shen Di Huang are also great at clearing the deficiency heat. We have Xuan Shen, that's going to help to remove the excess heat above. Dan Shen is going to help soothe the heart qi. It's good for the heart yin and to help move the blood. Fu Ling and Yuan Shi, that's to help to release the dampness that might be stuck in the upper jiao, also to help clear the brain, calm the Shen. Dong Gui, we can use also in this formula to help with nourishing the blood and yin and moving the blood. Wu Wei Tsa, again, to help retain the essence, retain the yin. Bai Zi Ren is going to be great for helping to calm the Shen in the cases of the heart yin deficiency affecting the Shen. Jagan, again, to help with the with lifting the formula to help remove the excess above, but also in helping with the dampness. And then Zhu is traditionally in this formula. We're not using that in the US because it's cinnabarus, it contains mercury, so it's not recommended for long-term use, and it is banned in the US. So now I want to move on to some patient education. And then I will get through this, and then hopefully we'll have some time for questions here at the end. So I mentioned a lot of this as we went, but just to clarify, for patients, it's good to educate them ahead of time so that they know what to expect, and so they know that they can come right in if they have any symptoms. And so for prevention, you want to help to instruct them that when they're feeling stressed, when they have more of a stress overload, they need to come in for treatment, because we have so many treatment options to help soothe their qi when they're stressed. But we can give them a few recommendations to move more, exercise even daily, try to walk daily, even 15 minutes twice a day of some kind of aerobic activity is enough to move the qi. Drink mint and tangerine peel tea. So I had mentioned that before. That's something that could just be on their playlist when they're feeling more stressed, that they have that ready to go. Also consume more vinegar, dark leafy greens, citrus fruit. You can instruct them on acupressure at gallbladder 34 and at liver 3. You can have them just rub these areas when they're feeling stressed. Also Taiyang is a good one. So you can also just mention rubbing Taiyang. And of course, seek treatment. And here I have a protocol, just a basic protocol for qi stagnation. Definitely send them home with ear seeds at Shen Men and the liver point. And then if you have a patient that tends toward more deficiency and exhausting themselves, help to instruct them on some Qigong exercises. I like to give all of my patients who are deficient in qi that quick little patting exercise that I did with you guys, just starting at the dantian and just patting very strongly, moving that qi in the area of digestion, following the path of digestion. So going clockwise on their stomach, moving that chi all over their body, everywhere they can touch, including their kidneys. Just gives them a nice little chi boost, and for us too. And it's great to demonstrate because then you get a little chi boost as well. Getting enough rest, of course. And then eating well, eating good soups, chicken and pork, basmati rice, the pears, the blueberries, or any kind of berries really. Instructing them on acupressure at spleen 6 and stomach 36. I like to then send my patients home with skin tacks at stomach 36. This is something that I'll do for myself, is I'll just, at the beginning of my day, I see a lot of patients. I have a very busy practice. So at the beginning of my day, I might put skin tacks at stomach 36 just to keep myself going, because I'm typically seeing anywhere from 4 to 6 patients an hour all day long. And then educating them at the first signs of treatment, seek treatment immediately. The early signs being that tingling, numb, or uncomfortable feeling on the skin, burning, feeling or itching with no lesions. They may have the body aches, the fever, the fatigue. So inform your patients that the treatments are available before this happens so that they know where to go. And then, of course, avoid spicy food, alcohol, greasy fried food, dairy, sugar. Consume more mung beans, dandelion greens, asparagus, bok choy, and melon. If our sores are present, you want to educate them that they are contagious, and they actually were contagious before the sores even developed. And so if they are around anyone who's immunocompromised or who's pregnant that did not contract chickenpox, they should instruct the people around them, if they have to be around them, that they should wear an N95 mask around them because it is inhaled droplets, or a triple mask. A regular mask isn't going to be enough. Honestly, the mask probably isn't enough anyway. So they should really avoid them. But if they have to go near them, wear the mask. If they have to touch them, wear gloves. And if you are one of those people, make sure that you're doing these things to protect yourself. If they already contacted these people, if they already had contact, tell them to tell those people to come in to get treatment right away. You can give them a course of Dermatrol HC or Puji Shao Yin to make sure that they don't develop it as a preventative. All right. So in summary, we talked about shingles and the virus that causes shingles to occur, the varicella zoster virus. We talked a lot about how that is the etiology and the pathogenesis, how it develops in the body, how it goes dormant and reactivates. We talked about the differential diagnosis, being toxic heat and damp heat. I apologize, my slides, for all the acupuncture components, I just put toxic heat. I meant to put toxic heat and damp heat for all of those situations, just to be clear. We also talked about the different organ systems that can be related and that could be affected by herpes zoster, and the treatment principles, the treatment strategies, and how to educate our patients. So if you have any questions at this time, please go ahead and if you want to just write them out, or you can always ask me after the class as we go through. I'll just scroll through. These are all my references. You'll have access to those. It's my contact information. So I'm more than happy to answer questions outside of this class. You can email me there. And if you call my clinic, you probably won't get me right away because I am so busy with patients, but you could always leave a message and I can get back to you as well. I have a question. How long do you give herbal prescription? So for the first stage, in toxic heat or damp heat, typically one bottle is enough. If they do not have sores present, that's a great question. Thank you for asking that, because I don't think I covered that. If they don't have sores present, as I mentioned, I can clear that within 6 hours, 2 doses. But I would still have them take that formula for at least 3 days. If they want to be really vigilant, they can just take the whole bottle. The whole bottle is about a 9-day supply, 9 to 10. I think it's like 9 1/4 dose. So they can take the whole round. That should be enough. One bottle of the Dermatrol HZ or of the Fuji Shaoduyan should be enough to clear that toxic heat or damp heat. And then you would move on to the next stage. The constitutional stage, you may have them on herbs a lot longer than any other stage. That might be a little bit more long-term until you see those results forming. The second phase, or if you flip it to the third stage, but the Chao Chai Hu Tong, that you may do for 2 or 3 rounds. I might have somebody on Chao Chai Hu Tong for 3 weeks to a month. And that's just because I really want to make sure we're clearing that Shaoyang, but that is if they're tolerating it. And so we might go back and forth between phase 2 and phase 3, depending on how their body is handling the herbal treatments. And then I have a question, how many acupuncture sessions would you advise for preventative treatment? Okay, so for prevention, I educate all my patients that every single patient I have should be coming in once a quarter at the very least. Now, that's really, I don't feel enough. And so most of my patients are on a maintenance level of once a month of getting preventative type acupuncture. Even if they're completely healthy, there's nothing wrong with them. I still like to have my patients come in at least once every 4 weeks, just to make sure we're still maintaining a good balance. And maybe we need to change their formula. Maybe we need to adjust some things, some nutritional recommendations, review their vitamins and supplements. So I find once a month is the best for prevention. Now, if they have been through these phases with you, and you're now going to the phase of constitutional balance and preventing a reoccurrence, then I would have them come in once a week for 4 to 6 weeks before then weaning them off to the once a month level. So I would have them initially come in, they might come in every day for a week if they have active shingles, or they might come in 3 times a week, at the very least twice a week. And they're in the active stage. At the second phase, when we're now harmonizing the Shaoyang, I would have them come in once a week, again, for about 4 weeks at that stage. And then at the more constitutional balance, again, once a week for 4 to 6 weeks, until then weaning off to every other week, and then every 3rd week, and then once a month. I have a few other questions. Could I clarify when to use water or witch hazel for the grapefruit seed extract? So don't use witch hazel if they have an open sore. It will burn. And you still can, but it's going to burn and they're not going to like it. So in that case, that's when I would use the water. If it's an open sore, you would use the water. If it's not an open sore, then you can use the witch hazel so that it penetrates the skin a little bit better, gets into the pores a little bit better. And then a question, can I repeat the preventative formula I mentioned? I think all of those are in the slides. Right, any other questions before we close up? Any questions that I missed, anyone? Let's see, go to the other. How long do you give herbal treatment with an active case? Okay, I think I answered that. How is good quality vitamin C toxic to the liver? For example, buffered C for metagenics. Yeah, vitamin C is not one I'm as worried about, definitely. I'm mainly worried about the fat soluble vitamins. But typically just find that so many people are on so many supplements that it's sometimes good for them to just have a break from everything and to get their vitamin C from the citrus fruit directly. So if I do take them off of a C, then I'm having them eat several tangerines a day so that they can get that vitamin C naturally. Because like the vitamin C and the zinc, those are 2 really good supplements to take while they have an outbreak or while they have an infection. So I don't necessarily want to take them off those, but if they do have this really stagnant liver qi, we may just want to take a break from all just to make sure. All right, thank you, everybody. I really enjoyed teaching you guys, and I really enjoyed your questions. Great questions, great presence. Thanks for being here, and I hope to see you again soon. And good luck on your quiz.
Thank you, Dr. Armstrong, for the engaging and insightful class. Your expertise has provided us with new ideas and perspectives. We appreciate all the attendees for joining eLotus and having us as your CEU provider. Your dedication to lifelong learning is highly valued, and we are committed to serving your educational needs. If you enjoyed today's webinar, please share with your colleagues to help us reach more professionals like yourself. The CEU quiz will be available tomorrow, and you'll receive an email notification when it's available. Thank you again for joining us. I hope you guys have a wonderful rest of your day, and I look forward to seeing you at our next webinar on August 6, 2023, Evidence-Based Acupuncture for Neuropathy with Scotty Hudson. See you then. Bye.